memakai bahasa Indonesia. Terima kasih. Good morning, ladies and gentlemen. My name is Laura. It is a wonderful and precious opportunity for me to be your master of ceremony on this great day at STIKES Telogorejo Semarang. On Tuesday, November 30, 2023, in our event, the 5th International Conference on Health Practice and Research, and with the theme, Interprofessional Collaboration in Preventing, Promoting, and Curing in order to improve the quality of life in children with stunting. First of all, let's say thanks to God who has been giving us guidance, happiness, health, and mercy, so we can attend and participate in this event without any obstacles. The international conference will be held by online and offline. Thank you. In this beautiful moment, I would like to welcome our speaker today. First, Prof. Chin Yang Chang from Hung Kuang University, Taiwan. Second, Prof. Dr. Apawan Nokong from Mahidol University, Thailand. Third, Amalin Suarez Minorca from Emilio Aguinaldo College, Philippines. Fourth, Dr. Mos Saswen Abdul Wahad from University Teknologi Mara, Malaysia. Fifth, Nurse Siti Lestari, Magister Keperawatan, Spesialis Keperawatan Anak. Sixth, Tia Nurhanifa, Sarjana Sains Serapan, Magister Kebidanan. Seven, Apoteker Anifatus Saada, Magister Farmasi. And then eight, Ragil Aldil FA, Sarjana Fisioterapi, Magister Kesehatan Masyarakat from STIKES Telogorejo Semarang. The Honorable Keynote Speaker, Yunita Dias Suminar, SKM MSc MSI, Head of the Central Java Provincial Health Office. Yang kami hormati Ketua Yayasan Kesehatan Telogorejo Semarang, Dr. Kuspintoro Singgi, Magister Manajemen. Yang kami hormati COO Yayasan Kesehatan Telogorejo, Ibu Glenda Anjeli, Sarjana Ekonomi, Magister Manajemen. Yang kami hormati Direktur SMC Telogorejo Semarang. Yang kami hormati Direktur Keperawatan SMC Telogorejo Semarang. Yang kami hormati Kepala Ruangan SMC Telogorejo Semarang. Yang kami hormati Kepala Instalasi Farmasi SMC Telogorejo Semarang. Yang kami hormati Supervisor Fisioterapi SMC Telogorejo Semarang. Yang kami hormati Kepala Bidang Stunting SMC Telogorejo Semarang. Yang kami hormati Ketua DPD PPNI Provinsi Jawa Tengah atau yang mewakili. Yang kami hormati Ketua DPW PPNI Provinsi Jawa Tengah atau yang mewakili. Yang kami hormati Ketua Cabang IVI Kota Semarang. Yang kami hormati Pengurus Cabang IBI Kota Semarang atau yang mewakili. Yang kami hormati Ketua Cabang IAI atau yang mewakili. Yang kami hormati Ketua Cabang PAVI atau yang mewakili. Yang kami hormati Ketua STIKES Telogorejo Semarang, Dr. Swani Trikayanti Widya Amadja, Magister Kesehatan, Doctor of Philosophy, and all participants of the seminar present today. On the special morning, we have several agendas, so allow me to read several sequences of our agenda. First, opening, Second, singing to the national anthem. Third, committee chair's report from committee chief. Fourth, welcome speech from head of STIKES Telogorejo Semarang. Fifth, keynote speaker from head of Central Java Provincial Health Services. Sixth, seminar and discussion session 1. 7, entertainment. 8, seminar and discussion session 2. 9, oral and poster presentation, and finally is closing. Ladies and gentlemen, before we begin this event, let's all pray together that God will make this event beneficial for all of us and that this event can run smoothly and conducively. Praying starts. Finish. Singing the song Indonesia Raya. The attendees please standing for the national anthem. Thank you, everyone. Please take your seats. The next session, Committee Chair's report from Apotheker Dr. Randa Tunik Saptawati, Magister Science Medical. Time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Praise be to Allah, the most merciful and gracious, who has given His grace and blessing, so we get the opportunity to hold the 5th International Conference of Health Practice and Research in 2023. This conference is an annual agenda of STIKES Telogorejo Semarang. And this year, the big topic is interprofessional collaboration in preventing, promoting, and curing in order to improve the quality of life of children with stunting. This conference consists of 3 activities: seminars, oral presentation, and poster presentation. All health providers, including nurse, midwives, pharmacists, and physiotherapists, as well as the academician, collaborate to contribute in this conference. Distinguished ladies and gentlemen, we convene that this conference attended by 600 seminar participants who attended. Thank you. The participant attended directly at STIKES Telogorejo Semarang and via Zoom meeting platform. The presentation of research in nursing, midwifery, pharmacy, and physiotherapy in the form of oral presentation was attended by 38 participants. And by poster presentation was attended by 25 participants. Thanks you, participants. On this place, we give our appreciation to the all invited speakers. Prof. Apawan Nokong from Mahidol University, Prof. Chi Yaojan from Hung Kwang University, Taiwan, Dr. Muhammad Sahiswan from University of Teknologi Mara, Malaysia, Dr. Emalin Suarez from Emilio Aguinaldo College, Philippines. And so to Nurse Siti Lestari, Ragil Aidil Physiotherapist, midwife Tia Nur Hanifa, and pharmacist Anifatus Saada, who were willing to share their knowledge and experience for all conference participants today. Our appreciation also goes to Centro Escolar University Philippines, which support this conference as a co-host. To the all member of organizer committee, we would like to thank for all effort to organize this conference well. Distinguished ladies and gentlemen, we apologize if our effort and service still unfulfilled your satisfaction. We really hope that all participants can enjoy this agenda. Finally, we hope that this conference can provide for many parts, especially for handling cases of stunting in children, and become an event for sharing of research of health research. For our participants, please enjoy this conference happily. Thank you, ladies and gentlemen. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, Ms. Tuni, for your committee chair's report. The next session, welcome speech from Head of STIKES Telogorejo Semarang, Dr. Swani Trikayanti Widya Atmaja, Doctor of Philosophy. Time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Shalom, Om Swastiastu, Namo Buddhaya, Salam Kebajikan. Welcome to STIKES Telogorejo Semarang on 5th International Conference on Health Practice and Research. The Honorable Head of Central Java Provincial Health Office, Yunita Dias Suminar, SKM, MSc, M Science, as our keynote speaker. Head of Telogorejo Health Foundation Semarang, Dr. Kuspintoro Singgi, MM. CEO Telogorejo Health Foundation, Glenda Anjali, SMM. Director of SMC Telogorejo Semarang, Nursing Director SMC Telogorejo Semarang. Head of DPD PPNI Provinsi Jawa Tengah. Head of DPW PPNI Provinsi Jawa Tengah. Branch Head IFI Kota Semarang. Branch Organizing IB Kota Semarang. Branch Organizing of IAI. Branch Head of PAFI. Our invited guest, Management of Central Scholar University, CEU Philippines, as our co-host in this 5th International Conference on Health Practice and Research, our speaker, and our lovely audience. Warm greetings for the day, ladies and gentlemen. Let us be grateful for God's love for us. I, Dr. Swani Trikayanti Widya-Atmaja, as head of STIKES Telogorejo Semarang, send my warm regards to all of you and welcome you all to the 5th International Conference on Health Practice and Research at STIKES Telogorejo Semarang. Firstly, I would like to thank the experts for taking their precious time out and making to this event. Secondly, I want to thank my audience for being present here today, online and offline. Before we begin with our today's session, please allow me to deliver a short speech in order to warm every regarding today's to be discussed key issues. One of the major topics of concern, ladies and gentlemen, is interprofessional collaboration and preventing, promoting, and caring in order to improve the quality of life in children with stunting. I'm sure our experts must have done their bit of studying around the topic, and so our audience. This is a topic that each one of us can relate with, particularly the working class. Number of stunting cases in Indonesia still in high level. Stunting, based on World Health Organization, define the impaired growth and development that children experience from poor nutrition, repeated infection, and inadequate psychosocial stimulation. As health professionals, we should do collaboration to handle this problem. This problem cannot be solved by one health profession, but it needs to be solved by a team that can work together hand in hand. Now, I would like to invite our honorable guests on stage and would request them to share their knowledge with us. It would really help us delve deeper into the subject and understand its nuances. It would also request my audience to remain seated and listen to our experts. And therefore, after this, they shall be liable to raise their doubts and questions. These doubts and questions then will be taken up by our panel of experts. In this occasional, I would say thank you to our speaker, Ma'am Yunita Dias Suminar, SKM MFC MSE, Head of Central Java Provincial Health Office, as our keynote speaker. Ma'am Associate Professor Dr. Apawam Nukong Mahidol University, Thailand, Sir Dr. Mohammed Sesiswan Abdul Wahab University Technology Mara, Malaysia, Sir Chin Yao Chang Hung Kwang University, Taiwan, Ma'am Emmeline Suarez Minorca, Emilio Aguinaldo College, and Nurse Siti Lestari, MKep, SPKep Anak, Apoteker Anifatus Saadah M. Farm, Ragil Aidil Fitriasari Adini, S. Fisioterapi MKM, Tia Nurhanifah, SST MKep, our lecturer as speaker in this conference. Thank you so much for all participants, around 600, followed by online and offline, including in this international conference event. We also organize the oral presentation and poster session. There are 38 oral presentation participants and 25 poster presentation participate from Philippines, Jakarta, Bandung, Kendal, Batang, Solo, Surabaya, Malang, Samarinda, Jayapura, and Semarang. Thank you, all participants. I end this speech with quotes from Nelson Mandela. Education is the most powerful weapon which you can use to change the world. It is in your hands to make a better world for all who live in it. Thank you so much, everyone. Enjoy this session. Wassalamualaikum warahmatullahi wabarakatuh. God bless you all. Thank you.
Thank you, Dr. Swani, for your welcome speech. The next section, keynote speakers from Head of Central Java Provincial Health Services, Ma'am Yunita Dia Suminar SKM MSc, MSE, time is yours. Please warm back applause from
Good morning, ladies and gentlemen. Okay, I'm sorry I can speak English well, so I will speak in Yang saya hormati Dr. Singgi. He is a person who always help patient who came to Gaza. Jadi kalau bicara Pak Singgi, tepuk tangan dulu dong buat Pak Singgi. Ya. Hebat, selalu menolong pasien, itulah jiwa-jiwa yang harus kita tumbuhkan. Kemudian Bu Swani yang luar biasa sebagai Ketua STIKES, karena saya dari Dinas Kesehatan tentu sangat senang karena Telogorejo itu dari zaman saya kecil itu terkenal dulu akpernya. Tepuk tangan untuk Telogorejo. Terkenal apanya? Terkenal hebatnya. Hebat, disiplin, etikanya bagus. Oh, enggak dengar. Jadi sejak saya kecil, saya rumahnya di Cilacap, jauh ya. Jauh. Di peta kayaknya enggak kelihatan. Tetapi Telogorejo bisa begitu hebat karena memang pendidikannya sangat disiplin. Kemudian Ibu Tunik tadi sebagai ketua panitia, saya matur nuwun diselenggarakan internasional konferensi ya yang mungkin ini adik-adik semua bisa mengikuti dan partisipannya sampai ke Papua tadi, Jayapura, kemudian mana lagi tadi? Filipina, Malaysia, Thailand. Tepuk tangan untuk Telogorejo sekali lagi. Kemudian seluruh din ya, seluruh dekan atau direktur dari masing-masing jurusan, tadi ada fisioterapi, perawatan pasti, kebidanan, farmasi, kesehatan masyarakat belum ya? Buka dong, nggak apa-apa. Nanti saya ngajar. Oke, baik. Dek, karena hari ini bicara stunting, mana yang perawat? Mana yang perawat? Oke, nah sekarang saya tanya. Adik tahu nggak sih stunting itu apa? Ayo, ini yang cantik ini, coba. Ayo, yang perawat jangan menundukkan kepala. Ayo, stunting itu apa?
Stunting itu pertumbuhan bayi yang tidak semestinya, kekurangan gizi. Tumbuh kembangnya tidak seperti anak-anak lainnya.
Ya, anak lainnya, kalau anak lainnya lebih kecil kayak saya contoh stunting ya. Dek, saya kasih tahu ya, karena ini berkaitan dengan interprofessional collaboration, berarti adalah bagaimana mengkolaborasikan, ya, mengkolaborasikan untuk yang sifatnya adalah preventif, promotif, ya. Apa sebetulnya pemahaman tentang stunting? Beda loh antara stunting dengan stunted. Tahu bedanya? Stunted itu seperti saya, pendek dan sangat pendek. Paham ya? Jurusan apa? Fisio bagian kalau orang stroke ya. Iya toh? Iya toh? Beres-beresin orang stroke. Oke. Jadi perlu dipahami bahwa kalau stunting itu sudah ada kelainan kognitif. Jadi tidak hanya pendek dan sangat pendek. Saat ini ada pemahaman yang mungkin perlu diluruskan bahwa kita bicara stunting, maka dia sudah gagal tumbuh dan ada pertumbuhan otak yang tidak sesuai dengan umurnya. Pertumbuhan tinggi badan juga tidak sesuai dengan umurnya, termasuk kognitifnya. Tetapi kalau pendek, coba yang mengaku pendek ada enggak? Berdiri coba. Dengan ibu sama enggak? Coba yang pendek ada enggak? Coba ada yang mengaku yang pendek? Masa enggak ada? Coba lihat. Anak kos ya? Anak kos bukan? Bukan. Kalau anak kos itu tanggal 1 sampai 10 bisa bayar makan ya. Begitu tanggal 20 ngebor ya. Iya enggak? Enggak. Oke. Jadi adik-adik, saat ini kenapa menjadi isu? Karena kita akan ada masa di mana nanti 2045 ya 2045 itu adalah harusnya generasi emas. Generasi emas berarti anaknya pinter-pinter. Jadi pinternya kalau pendek atau tinggi? Coba aku lihat sini. Ayo berdiri. Ayo berdiri dong. Berdiri. Ya kata apa? Ayo sini. Nanti itu kelihatan loh. Nah, ternyata dia lebih pendek daripada aku. Ya, tapi dia kan gini. Stunting itu nantinya dia nggak cerdas. Kalau ini cerdas dong, masuk Telogorejo, ya, tepuk tangan. Jadi ini hanya pendek saja, tapi bukan stunting. Ya, paham ya? Nah, oke. Silakan duduk. Nah, itu yang cowok-cowok kayaknya kurus cacingan enggak? Ya, kalau cowok kan gitu ya. Makanya mie instan atau sampai keriting rambutnya ya. Oke, nah jadi pada hari ini kenapa isu ini kemudian diangkat oleh Telogorejo, saya berterima kasih. Karena adik-adik semua harus paham dulu tentang itu. Jadi nggak hanya jurusan keperawatan dong yang tahu, semua harus tahu. Kenapa? Karena harus diintervensi dari remaja putri. Mana yang putri, remaja putri? Nah, yang putra suka mengalami haid? Oh enggak, ya. Jadi remaja putri kenapa harus menjadi perhatian? Karena tiap bulan mengalami datang bulan atau haid atau menstruasi. Kalau sampai terjadi anemi, maka ketika nanti dia, kalau sekarang itu adik-adik tahunya kalau melahirkan itu umurnya harus berapa? Berapa? 15? Oh, oke. Harus di atas 20 tahun. Kalau dari remaja putri kemudian tidak diperhatikan asupan makanannya, maka nanti bisa anemi. Kalau anemi punya potensi melahirkan anak yang tadi. Apa? Iya. Jadi menjadi perhatian itu yang pertama. Jadi adik-adik nggak boleh ya. Sudah punya pacar belum? Aduh, gimana nih Pak Singgih pada belum punya pacar? Ya, boleh pacaran, tapi nggak boleh aneh-aneh, nggak boleh. Lah iya, masa jemblik nanti deposito ya nggak boleh. Jadi harus di atas umur 20 tahun baru boleh hamil dan melahirkan, ya. Itu ada ketentuannya. Nah, nanti ketika ibu hamil sama, dia juga harus punya asupan makanan yang baik, bergizi, supaya nanti dia juga melahirkan anak yang sehat. Nah, kemudian gimana kalau ibu hamilnya tidak sehat? Ya pasti akan melahirkan anak yang tadi stunting. Bagaimana cara intervensinya setelah dia stunting? Yang boleh mengatakan dia stunting atau tidak adalah dokter spesialis anak. Dia yang harus melakukan penegakan diagnosa. Maka kemudian harus dilakukan intervensi untuk gizi yang baik. Gizi yang baik untuk tadi remaja putri, ibu hamil, dan balita. Supaya dia terhindar dari stunting atau melahirkan anak yang stunting. Apa yang harus diasup makanannya? Yuk, perawat. Ini perawat toh? Oh, fisioterapi, salah. Mana lagi perawat? Kok nggak ada yang, ayo tunjuk jari. Mana yang perawat? Nah ini kan udah tadi. Yang lain, ayo. Ih, masa penakut? Ayo. Perawat Telogorejo tuh hebat loh. Tepuk tangan lagi. Ayo. Ayo, mana lagi? Mana? Mana? Ada? Ini apa ini? Visio, banyak semua kok visio ngakunya. Semua visio. Ya, protein hewani. Ya, protein hewani. Jadi adik-adik semua harus paham bahwa ketika sudah stunting akan sulit sembuh. Kalau sudah stunting, karena dia sudah punya gejala yang tadi. Akan sulit sembuh. Maka di sini disebut preventingnya, pencegahannya, peningkatannya atau promotingnya. Jadi jangan sampai terjadi. Ya, bagi yang sudah pendek-pendek gimana ini yang pendek-pendek tadi? Yang sudah pendek-pendek gimana? Mau gimana? Ayo. Berenang terlambat. Main basket terlambat juga ya. Nah, jadi makan protein ya, protein hewani. Suka itu enggak? Ikan. Ngerti jenis-jenis ikan enggak? Nanti dikasih sepeda. Ya. Jadi, Dek, kalaupun anak kos, mana yang anak kos? Coba saya pengen tahu. Coba tunjukkan jari. Yang anak kos. Anak kos ya. Bu, uangnya cuma dikit. Ya udah makannya telur aja. Telur tiap hari telur, tapi nanti kalau kebanyakan jadi conon ya, bisulen ya. lele juga boleh, ikan juga boleh. Yang penting asupannya itu yang sesuai tadi saya sampaikan, protein hewan. Paham ya? Nanti bisa nggak adik-adik ikut penyuluhan di Dinas Kesehatan Provinsi kalau saya punya kegiatan? Bisa ya? Mau ya? Oke Pak Singgi, nanti anak-anak tak ajak ini ya untuk bisa memberikan penyuluhan kepada masyarakat. Pesan saya sekali lagi sebagai tenaga kesehatan, sebagai provider kesehatan, adik-adik itu harus menjadi contoh bahwa adik-adik itu sehat. Ya, petugas kesehatan kalau nggak sehat gimana? Aneh ya? Aneh, masa ciler? Takut ciler enggak? Masa cacingan itu kayak yang di belakang? Ya, jangan. Ya, jadi harus sehat. Mungkin itu saja yang dapat kami sampaikan. Selamat Telogorejo sudah tahun kelima menyelenggarakan seminar internasional ini dan adik-adik harus fokus mengikuti ya sampai selesai dan adik-adik harus berpikir memajukan STIKES dengan prestasi-prestasi yang luar biasa. Gitu ya. Tepuk tangan untuk STIKES. Saya cukupkan sekian. Salam, swastiastu, namo buddhaya, salam kebajikan, rahayu.
Thank you, Ma'am Yunita, for the insightful speech. And then the next session, giving certificate and gift from Dr. Singgi to Ma'am Yunita Dia. Mr. Singgi and Ma'am Yunita, please come to podium. Thank you. Thank you, everyone. Thank you, everyone. Akan kita masuki sesi foto bersama. Saya minta dengan hormat para tamu undangan, pembicara panitia, beserta para partisipan untuk bisa berdiri di tempat. Oke, kita akan menghadap, berdiri di tempat saja. Berdiri dan menghadap ke depan. Kita akan lakukan foto bersama, ada 3 sesi foto bersama. Yang terhormat para tamu undangan, mungkin bisa membuat satu sejajar dan kita akan lakukan 3 sesi foto bersama. Izin saya untuk memandu untuk foto bersama. Baik, mungkin teman-teman yang masih memakai masker kita buka terlebih dahulu sebentar. Ya, kita buka terlebih dahulu. Senyum yang manis buat di foto teman-teman semuanya. Baik. Oke, gaya formal 1, 2, 3. Baik, gaya semangat. Ya, gaya semangat. 1, 2, 3. Oke, baik, dan terakhir I care. Core value STIKES Telogorejo Semarang. Oke, I care. Yang kelihatan ke belakang ya. Oke, 1, 2, 3. Terima kasih Bapak Ibu dan para tamu undangan. Silakan duduk kembali. Ya, kita akan lanjutkan untuk kegiatan kita. Okay, ladies and gentlemen, we continue this agenda. The next item on the agenda is entering the fourth seminar and discussion event, which will be guided by our moderator, Apoteker Gilang Rizky Alfarisi, Magister Pharmacy. Before that, let me read the CV or Mr. Gilang. Name, Apoteker Gilang Rizky Alfarisi, Magister Pharmacy. Please big applause from him. Was born in Gunung Tabur, East Kalimantan. Education background Magister Pharmacy at University Armadalan in 2019 and many research about pharmacy unquestionable for the last 5 years. Without further ado, I invite Mr. Gilang will guide it in seminar session. Let's give them warm round of applause as they come to the podium.
Thank you, Ms. Ola, for the change. Okay, good morning, everyone. How are you today? I'm fine, thank you. Standard. Okay, I would like to thank to Ms. Laura for giving me the chance to guide the event until the end of section 1. Assalamualaikum warahmatullahi wabarakatuh. Welcome to the seminar research, the first international conference of health practice and research with interprofessional collaboration in preventing, promoting, and curing in order to improve the quality of life in children with stunting. His Excellency, the head of Telogorejo Foundation, Dr. Kuspintoro Singgi, respectable, the Chief of Institute of Health Telogorejo Semarang, Dr. Suwani Trigajanti, Magister Kesehatan, the Honorable all Head of Department, Lecturer, and the participant of this seminar. Ladies and gentlemen, let me introduce myself. I'm pharmacist Gilang Rizky Alfarisi from Pharmacy Department. I'm very pleased to see you here and welcome to all of you to this seminar. Before we start this section, I would like to read the sequence of this seminar. It consists of part. The first section, it will be presented by external speaker, Madam Afan Nokong, PhD, pediatric neuro practitioner, and Moh Sezwan Abdul Wahab, PhD, as a pharmacy speaker, which following discussion panel. And then the second part will be presented by internal speaker, pharmacist Anifatus Ada, Magister Pharmacy as pharmacy speaker, and nurse Siti Lestari, Magister Keperawatan, spesialis keperawatan anak as nursing speaker. Okay, all participants who present in this room can propose a question directly, and who join in Zoom can text the question on the chat box. Maybe Mrs. Apawan Lokong, PhD, can join in this Zoom meeting. Good morning, Mrs. Apawan. Good morning, madam. The mute, it's still mute.
Good morning.
Good morning, madam.
Good morning. Can you hear me?
Yes, very.
Is it clear?
Yeah, really clear. Absolutely. Madam, okay, you will be the first speaker in the section. Yeah, I will give you 40 minutes. Yeah, to present your subject. Yeah. Before I place your presenting, let me see the curriculum vitae from the first speaker, Madam Afwan. Please, let me read it. Okay. Okay, there is. the curriculum.
Can you see this PowerPoint?
Okay.
Can I start now?
Let me read your curriculum vitae first, madam.
Okay, thank you so much.
Okay, Miss Madam Amawan Nokong, PhD, pediatric nurse practitioner. She has finished his Bachelor of Science in Nursing in midwifery at the Prince Songkla University, Thailand. She continued to her Master of Science, PNP, Pediatric Nurse Practitioner program in University of Alabama, Birmingham, UK, and finished in 2000. In 2005, she finished PhD program of nursing in University of Iowa, USA. She has been a nursing program lecturer at the Faculty of Nursing, Mahidol University, Bangkok for 26 years. An area of expertise is respiratory care in pediatric, psychosocial care, and health promotion for early childhood. There is so many publications that can be tracing in her expertise. One of them is causal relationship among self-management behavior, symptom control, health-related quality of life, and the influencing factors among Thai adolescents with asthma. International Journal of Nursing Science, factor influencing quality of life and nutritional status of 0 until 2 years old children, Siraj Medical Journal, and the last implementation of the nutritional promotion guideline for preschool age children with overweight in a child care center, Thai Journal of Nursing Council. Okay, that's the curriculum vitae of Madam Afawan. Madam Afawan.
Okay, thank you so much for very nice and sweet inducing me to this audience. First of all, I would like to thank you, host, to invite me to join the 5th International Conference on Health Practice and Research. And the topic for this conference is very interesting. Especially it's related to improve the quality of life for children. For my experience, I may not have much experience about stunting, but as I work with the children in Thailand, most of them has problem with overweight and obesity. However, the project that I work with the community and healthcare center teach me a lot about the process, how to improve the nutrition for toddler. So today I think I will share some of my experience with you, and during the presentation, in case that you have any question, feel free to interrupt or ask me. Okay, let's see. The first of all, for the introduction is the global stunting. Most of the Asian is this range around 20 and to 27% per million. 20 million of the children have stunting, compared to another regions like this one is this global, and the blue one is Middle East and North Africa. This still this blue one like here. They still have the huge problem there because of these many reasons. And for talking about the stunting, most of us use the weight and height. For this, we think about the weight per age, height per age, and weight per height. And from that schedule, from that information that we measure, then we put it into the interpret it. First of all, mostly be familiar with weight per height that interpret the result in terms of obesity or thin, or sometimes we call malnutrition. By the way, there's many strategy that we use to interpret the result. The first one is weight for age, that we can interpret as underweight. Stunting, this we get the information from height for age. And what the definition of stunting? Stunting is the height for age that lower than the second, the minus 2 percentile from the median of the growth chart. And from this, and from this, I think this might be the standard one that all of us can take a look and find out some more information from World Health Organization. This, I think this might, all of you may familiar with this, so I select the girl for example. From this, I got this chart, and these are the interpretation of the weight high for age for this for the children with stunting. And from that stunting, we can classify it more in several levels. From the median line, from that we can take it and calculate it to classify as the first grade, second and third grade. These are for the stunting. It tells us about the chronic malnutrition when compared to the hyper age, that is acute malnutrition. So the when we found that children stunting, the question come up with why they have this problem. This slide compare the normal growth and stunting children. For the normal growth, children here may have the some of them they may short, but because of the genetic, for example, they have parents short stature. The second one is the hormone. Most of the children with the normal growth, they have a thyroid hormone normally. The third one, the nutrition intake. The normal health, they have the time and the schedule to exercise and have the quality sleep. On the other hand, children with stunting, they may have problems start from during the mother pregnancy, and the antenatal care, if they have any problem or any interruptions, and resulting in intrauterine growth retardation of the child. That means the child is born with stunting. The second one is chromosome abnormality. Right now, there's many diseases come up with the chromosome abnormality and leading to the stunting, and some of them may have the some illness, some may have the delayed development. All of these leading to the problem of the growth of the child as well. The third one is hormone. Mostly for the growth of the child, they need growth hormone and thyroid hormone. And in for the growth hormone is quite related to sleep. In Thailand, we try to promote let the child go back to sleep earlier, like 9 p.m. However, we come up with a problem because right now children in Thailand use more time with the media, so they go to bed late, and we try to convince and educate parents about this, but we still have this problem. Another one is the precocious puberty. In children, when they turn to adolescence, if they have the precocious puberty, that means they have hormone of the estrogen and progesterone that interrupt the growth hormone and cause them short. For in Thailand now, the parents who can, if parents can detect the symptoms of precocious puberty earlier, for example, they have the acne, have the odor, have the
normal aku nih garap nih kono ra iso terus aku cepet-cepet balik rene.
So they tend to take them to treatment, and they receive the hormone that supplement that sex hormone, and let them to grow up a little bit. The another one is chronic malnutrition. For example, they have diarrhea or another chronic or the chronic illness like heart disease. Food consumption habit, for example, the habit of the child in eating, and including the parental practice as well. Some we don't have we don't know exactly the cause, so we call it unknown causes. From that cause, there's as I review, there's many of the study present about the factor related to child growth and stunting. They may separate in the child, parents, environmental and health system factors. For example, the parents factor. If parents provide exclusive breastfeeding and provide for a long time, for more than 1 year. Some right now we try to promote to 2 years. These provide the nutrition, but they need to have the supplement food at the appropriate time. For parenting practice, there's a study published in Indonesia talking about the parents' behavior. For example, pressure children to eat. That because a toddler child tend to against any pressure, they may refuse. Or some parents may have the eating restriction. They control for every pattern of food. For example, no sugar, no salt, no lipid. This restriction may make the child stressed and refuse to eat as well. Another one is the belief and culture. These are from my experience working with my master student in Thailand. In the northern part of Thailand, we that area have the highest stunting child when compared to the southern and the central regions. And some belief of the parents still influence the food habit, feeding habit of the parents. For example, they think that some prohibit food should not allow the children eat. For example, in the northern part, they scared of the they may not familiar with the seafish, or some culture they say that the child will eat fish when they talk the first word. That means they're ready to eat. These are the belief from the many generations, but they still teach to the young generation, Generation C and Gen Y. So for this, the nurse that work in the community need to talk to the elderly person about their belief as well. Another factor is the environment, like socioeconomic status, access to nutritious food, and lack of the access to clean and water and sanitation. This one I got from the information from the systematic review of the stunting prevention and control program published in the Indonesia. It's very interesting. And another one is the health system. Most of the literature say that limited health service is one of the leading of the stunt. And after that, I will talk about this later. And for the health promotion and prevention, mostly we try to promote the individual, children and their family, and their community, how to provide this nutrition and modify their lifestyle and food habit, provide the environment for them to exercise. For example, in daycare center, how can we provide the appropriate environment for them to exercise and have the appropriate food, and at the same time appropriate resting time. Let's see how much the children need, the toddler need for their growth and the prevent stunting. They need for the toddler need 1,300 to 1,800 kilocalories per day, and from this they still need high protein. So that means that we need to think that the food that we will provide for the child is that should be the same food as the parents or not, or they should prepare the food appropriate for their age, that's high in protein. And for the food consumption that the child needs, these are the one that we need to think about is that we ignore the sugar, salt, and fat is a little bit very small amount, but this we need for the vitamin as well. Mostly for the protein, or the we need 2 serving per day is very a lot. And milk and yogurt and cheese 3 servings. So that means they still need to have milk 3 times a day. So from this you will see that if we want to solve this problem, we need to know the information from the child's family, school or child care center, community, and the health service system that support the child, support the child health. First of all, if we have the children with stunting, we need to assess what the health status from them, the physical assessment and the nutritional assessment. The second one, identify cause of stunting, reduce risk factor and promote facilitator, provide treatment, for example, hormone supplement. This work we need the multidisciplinary collaboration and get family involved in this. And finally, we still need the community to collaborate with the family healthcare team as well. Most of the work today, I may focus on the nutrition because it's quite complicated and need more information to discuss and plan. The importance of the food and nutrition, this impact on the growth of the child, cognition, and this about the learning ability. The children with the poor nutrition has a lower IQ than the normal child. There's another one is the strength of the child is about the motor development, both the gross motor and fine motor. The emotion then that may lead them to the interaction with another child. Some children with the stunting and poor nutrition, they're quite busy, sometimes not active to participate in activities. On this side, there's important about the nutrition on immune system, organ structure, and the improve the wound healing. So, what is the nurse role on nutritional care? The first one, we need to identify who is the child with normal health risk group and who are the patients. This one, if we start from this, we can provide appropriate intervention for them. The second one, nurse need to develop the promotion and prevention program by work collaborate with the healthcare team. These three of these may focus in the community, school, and the child care center. On another side, nurse also work in the healthcare setting, like in the hospital or the clinic. Most of them, they are the patients, so nurse need to examination nutritional progress and patient respond to the nutritional therapy. The important one that we need to think about is that nurse needs to develop new knowledge and intervention. No, not intervention, innovation. Sorry. Innovation to solve the problem, because the stunting and the nutritional problem come up from several more than 10 maybe more than 50 years, but we still face this problem. The innovation does mean that we find out some new strategy to solve the problem. It can be any process or the program that appropriate for the setting. And for the first one, that assessment, the anthropometric measurement, I think everyone know it, how to measure it, including the measure the arm circumference. The another one is physical assessment. Nurse has learned about the physical assessment, and this one help you to identify the characteristic of the standing charts and the present of them. For example, the hair that is dry and the color change, the fat under the skin, the bone, the characteristic, the size of the body, the functional status, and the strength and flexibility that you can examine. The biological assessment, for example, blood, urine, or stool. And then for the stool assessment, as I remember when I was young, there's some clinic mobile take the mobile car to the community and ask the parents to collect the child stool, and they looking for the womb that contained in the stool, and at the same time, if they found it, they look using the microscope to find it. If they found it, they provide the medication to treat immediately. So that means the system that provide the healthcare directly to the community, especially in the rural area, is important and can solve the problem directly. And the dietary assessment, I will talk about this later. Okay, for the dietary assessment method, mostly in Thailand, we use the 24-hour records where we interview what they eat, what the child eat in the past 24 hours. Food frequency questionnaire, this might be the one that asks the parent to inform us food record. And I will show you the characteristic of the food record that we use. Mostly for the food record, used in the patient, used with the patient in clinic. By the way, right now we use this as a tool to allow the parents to monitor themselves, that how much the child eat per day, and from this they provide the food right down. For example, 2 bread and 1 glass of milk, egg, and then we have the nutritional work team to calculate this and put and combine it into the calorie that the child get for each day. This is quite accurate, and from this right now we have the calculator, like a program to calculate that may help to us to have the exactly information. From that, the one information that all the information that we talk, that I already talked, is can summarize in the flow that what is the nurse and the healthcare team can do. For the first one, this nutritional screening, as I present with the many tools there. we classify this into the no risk or low risk. This group we can recheck and come back for the nutritional screening. And the another group is children with the at risk for stunting. We should identify what are the problems, including the nutritional assessment. For the from these children with the problem, we we come up with the nursing diagnosis to identify what are their problems. Is that problem from the child? Is that problem from the parents, community, or healthcare system, or combine all of that? And then we provide the program appropriate for individual to solve the problem. These are the flow that help the nurse identify the important the at-risk group and provide the intervention to them. And what the nurse should do after they come up with the nursing diagnosis. The nursing diagnosis get from the information they collect from the patients, from the community, and from the their lifestyle. What we can do for the first one might be promote knowledge, practice, and child care skill. For what is the child care skill? Child care skill. Let me share my experience as I work in the community and in the child care center. The child care skill right now, we found that parents, most of them work. They work both parents and both father and mother, and child was taken care by the grandparents at home. And because of the child is taken care by the older caregiver. Some of them may not prepare for the food for the child, and some of them buy some food that may be I think they can eat and the child can eat as well. So the program that I provide to them is that we invite them and have the group discussion to find out what are their problem, and let each group share their idea how to solve the problems. And one of the issues that they come up is that some child has several caregivers, and some of them provide the food that they think the child like. For example, snack, because in Thailand, we may provide the food to the children, present as that is love and care for them. And most of the food that the caregiver buy for the child is dessert, snack, and if they eat that food too much, they come up with they do not eat the healthy food, and then we change their belief. How if we love the child, what should we do? That is one of the issues that we provide in the program. And the second one is the empowerment program. Some parents think that they cannot cook and they cannot manage the child, and we have the funding activity like cooking, with meeting for cooking, and that let them practice food preparing for the child, the health literacy.
Madam, sorry.
So Oh, sorry. How long?
Remaining 10 minutes again, madam.
How many minutes?
10 minutes.
10 minutes. Okay. Okay. So thank you. So these are the strategy that we need to talk to the parents, that the child learns to feed by themselves. So we need to provide them to practice this skill with the small help with the glass and cup, and think about that they are developed independent, so they sometimes refill the certain of food. For the child care practice, first one, make the mealtime presence times. Offer the variety of simple, attractive food. Do not use food as reward. Schedule meal, sleep, and snack time. And to make sure that they have the optimal appetite and behavior, avoid to use routine use of sweet dessert. Another that is the one that I only talk is about the program that we should talk to the parents. The another one is the program that we should collaborate work with the child care center. As the children stay in the child care center, teacher can be the person to promote the child health. And from this, from my program, I use the educate teacher. Actually, the teacher calculate the child nutritional status, but we provide them the program that easy to calculate. Therefore, they know that the characteristic of the child, that these are the program that we use, and we put the weight, height, and then they interpret the result. From this, the teacher know the teacher know the oops, sorry. Know the problem, and then they inform this information and to the parents, and let the parent know that how to solve the problem. This one, teacher can teacher is the important person that we need to work collaborate with them. Another one that is we have the Thai school lunch program. This one provide the menu for the child appropriate for their age. The another one is the Ministry of Public Health, that they have the health record data. So the information that the teacher measure can send to the nurse and report to the center. The another one is the setting in the healthcare setting. We have the screening for the newborn. So they screen for the hypothyroidism and the metabolism disorder, that we can solve the problem earlier. For the multidisciplinary, I already talked about the high-risk group, the continuing care from hospital to home and school. And the another one is treating the health problem. For example, the diarrhea infection or the oral care that may influence the child health. Another one is the education of parents. Actually, in Thailand, we have the media that used to teach parents, and the how to use this media is the nursing role to educate parents and put them into the right channel to the parents. The health policy in Thailand, we subsidize for childcare in low-income family. With the money is quite a little bit to support their food and their care. And we have a free school lunch until children in the 6th grade. And for another the measurement that we use in the hospital, for example, Strong Kid, I think you may use this in Indonesia as well. And this one we use to classify the high risk group. The last important one that I will talk is about the program that we use, fighting program for stunts. This from the systematic review that I found. This program, I think they come up with this big program based on the problem that they face. The first one is the program improve environment and hygiene program. This one, they provide the healthcare worker to educate community about the environment, because that might be environmental problem and the water and the sanitary. The second one, the program provides supplement nutrition. This one provide the ferrous sulfate, folic acid, and the protein supplement to the family, and this can improve the stunt as well. The third one, the support the program that improve parent involvement in caring for the child, and this one is success as well. I think this might be fit with the many countries in Asians. Some of these may use the combined program. For this one, they provide the environmental care and the funding support for nutrition. The next one that I found is talk about the parenting role. They talk about how to educate parents, both father and mother, about the food, the technique of feeding, how to solve the problem. And the last one that I think I already talked about this, some of this is family and child care center involvement. This one that I work with the family and the teacher in child care center, how to provide the program direct to the family and support the teacher in school to be the change agent to improve the child care in the community. And the one that I think is very interesting is the program from the UNICEF. That is a 1,000 days approach for nutrition activity from pregnancy until 2 years. This provide the nutrition support for mother, and they provide exclusive breastfeeding and improve the nutrition of the children. I think okay. Thank you so much. I try to finish. I think is it in time, right?
Okay, thank you, Madam Afwan. It's still 8 minutes. Yeah.
Okay, so I think this might be the time for an audience to ask me.
On Zoom, because there was a question for you, and we we must continue to second speakers.
Okay. Okay. Thank you so much. Let me unshare this.
And the last, after this second speaker presentation, we following the discussion panel.
Okay.
Okay. Thank you. Big applause for Madam Apawang.
Thank you.
Okay, then we can continue to the next speaker, Mr. Sazwan. Is still in Zoom.
Yes, I am.
Okay. Good morning, Sir Sazwan.
Good morning to you too.
Yes, you look really charming, sir.
Thank you very much.
Welcome. Okay. Sir Sazwan, yeah. I will give you 40 minutes to presenting the subject. Before you presenting your subject, let me read your curriculum vitae first. The committee, please. Okay. There was the curriculum vitae of Sir Sazwan. Sir Muhammad Sazwan Abdul Wahab finished his Bachelor of Pharmacy honors in University of Technology Mara, Malaysia. He continued to her Master of Clinical Pharmacy in University of South Australia and finished in 2010. In 2019, he finished PhD in Pharmaceutical Care, Chulalongkorn University, Thailand. He has been a lecturer in pharmacy practice, UITM, Malaysia for 13 years. An area of expertise is herbal and dietary supplement, geriatric pharmacy, and pharmacy education. Now, Sir Moh Sazwan is to serve as Deputy Dean for Academic Affairs, Faculty of Pharmacy, UITM, Malaysia. There is so many publication and experience from Sir Sazwan as invited speaker and teaching experience. The kind of his publication that published in 2023 is the use of herbal and dietary supplement for COVID-19 prevention, a survey among the public in the Malaysia suburban town, Journal of Herbal Medicine, some learning about herbal and dietary supplement, perspective using the theoretical domains framework, International Journal of Environmental Research and Public Health, and the last drug natural product relate problem in elderly, progress in drug discovery and biomedical science. Okay, Sir Sazwan, we will give you 40 minutes to present the subject, so the time is yours.
All right. Can you view my slide?
Yes, clearly.
Okay. All right. Thank you very much to the Masters of Ceremony. Thank you for the kind introduction. My name is Muhammad Shahizwan Abdul Wahab. I'm from the Faculty of Pharmacy, University Technology Mara, Malaysia. And I'm very thankful to be invited to share information regarding dietary supplements in this international and prestigious conference. So I'm a pharmacist. So my content today are basically from the perspective of a pharmacist. Yeah, I'm sure that today the attendees comes from various backgrounds. So I hope that my presentation would benefit the audience today. So let's start. So I have attended the talk by the previous speaker, Associate Professor Dr. Apawan. It was a really nice presentation, and she had given a very nice introduction regarding stunting. So all of us know that this is a problem worldwide, and it affects a lot of children all around the world. And we know that there are a lot of women and children in the world had experienced a negative consequence from poor nutrition. And fortunately, in the last decade, we have been various products such as home fortification has been introduced to overcome these issues. And there are also a lot of dietary supplements out there that can help to improve nutrition among pregnant women, among children in our country. So basically, stunting, we know that it is a condition that affects the growth and development of children. And one of the factors is malnutrition. So we want a child to have a balanced and nutritious diet so that they would have a good overall health and growth. There is no specific dietary supplement that directly addresses stunting, but there are a lot of nutrients that can help with the growth and overall health of a child. And I always remind everyone to consult with the healthcare professional, whether it is a pharmacist, a doctor, a nutritionist, a dietitian, so that these products can be used safely and appropriately. So these are some of the nutrients that can benefit children and also benefits women who is pregnant. These nutrients include calcium, iron, vitamin D, zinc, vitamin A, vitamin C, omega-3 fatty acids, the B vitamins, and also iodines. And we can see that these nutrients can help with the development of a child. For example, calcium, we know that it is important for the development of bone and teeth, and iron is important for the production of red blood cells. So all of this would promote health among our pregnant women and also young children. So what do we know so far? So basically, the literature has shown that mothers who rarely consume milk, vitamins, and folic acid during pregnancy, they are more likely to have children who have stunting. And pregnant women with anemia and upper arm circumference of less than 23.5 centimeter are also likely to have a stunted child. And we also know that breastfeeding practice is a protective factor against stunting. But although breastfeeding practice is important and can reduce stunting, we need to ensure that breastfeeding mother obtain adequate and healthy nutrition for them to provide the nutrition to their child. Yeah, so basically, if we want to prevent stunting, we want to intervene at the pregnancy stage, and while they are breastfeeding their children, and also we may want to improve the nutrition among the babies, the children themselves. Yeah, so from the perspective of pharmacies, we have a lot of dietary supplement products that we can recommend to a pregnant woman, for example, to improve their nutrition. So we want to know what are the nutrients that are good for them. So of course, micronutrients. We have pregnant women need to take adequate protein, adequate carbohydrates, and adequate fat during pregnancy. And we can see here that the recommended intake for protein for pregnant women is much higher than those who are non-pregnant. So this for pregnant women, we may want to recommend them to take higher amount of proteins daily. And for carbohydrates, the proportion should be around 45 to 60% of their calorie intake, and the fat intake should be around 20 to 35% of their daily calorie intake. So these are the recommended daily dietary allowance for pregnant women and lactating women. And we can see here the recommended daily dietary allowance for pregnant and lactating women is higher compared to when they are not pregnant. So I highlighted the nutrients in red that shows a requirement for increased intake for pregnant women and lactating women. So nutrients such as vitamin A, vitamin D, folate, the B vitamins, iron, selenium, and zinc should be taken in higher amount compared to when they are not pregnant, so that they would have, so that we can promote healthy fetus and healthy baby when they are born. So the table that I showed earlier is the recommended daily intake. So this is the intake that is recommended for us to have to be healthy. But we need to remember that not everyone is healthy, and sometimes poor health can impact the absorption, metabolism, and excretion of certain vitamins. And therefore, for some people, they need to take a higher amount of these nutrients so that we can solve their problems in terms of their malnutrition. So for pregnant women, we usually recommend a daily prenatal vitamins, and this is advised for pregnant women to take it before and during pregnancy. And there are a lot of daily prenatal multivitamin products out there. But the difference can be attributed to the amount of folic acid of the product. So some may have higher amount of folic acid, and some may have a lower amount of folic acid. And we know that folic acid is important for the development of the fetus during pregnancy. So other types of vitamins that are important for pregnant women, including children, are vitamins. We know that vitamins should be a part of our daily diet, on top of proteins, minerals, carbohydrates, fats. So vitamins, there are two categories: the water-soluble ones and the fat-soluble ones. So water-soluble vitamins are like vitamin C and vitamin B, and fat-soluble vitamins are A, D, E, K. So these are the types of vitamins that are essential to pregnant women, lactating women, and also children. So this is for vitamin C. We can see that the recommended daily intake for vitamin C for babies pretty much low, it's just 40 milligram. But you can see that there is a need to increase the intake of vitamin C in pregnant women and lactation. And we should also be able to recognize the symptoms of deficiency of vitamin C, especially among pregnant women, so that we can advise them to take to increase the intake of these vitamins. And some of the symptoms of deficiency of vitamin C is slow wound healing, easy bruising. You can see that their skin is dry, their hair is dry and splitting, they have problems with their gums. So those are the symptoms of vitamin C deficiency. So yes, if you encounter a mother who is pregnant and comes with all of these symptoms, maybe we can think of we can suspect and think of a vitamin C deficiency. And also we know that some women may be smoking as well. And those women are the ones that can be depleted in vitamin C, and we want to also suggest for them to increase their intake of vitamin C as well. And vitamin C is important because it enhances iron absorption. And we know that pregnant women is also at risk of having anemia as well. So if and iron is an important nutrient, right, to prevent anemia. So vitamin C can help with the absorption of iron, and we want pregnant women to take enough vitamin C and enough iron so that they can improve their health, and they can improve the growth of the fetus, and hopefully this can reduce the incidence of stunting among their children. Some advice regarding vitamin C: high dose may cause loose bowel movement, and we always advise the users of vitamin C to rinse them out, because vitamin C contains ascorbic acid that may damage the tooth over time. So this is one of the recommendations. And one thing that we need to remember from the perspective of a pharmacist, dietary supplements, although it is usually perceived as entirely safe, it also have adverse effects, and it can interact with a lot of medications or products out there. So for example, even vitamin C, it can interact with aluminum. There are a lot of products out there that contains aluminum. So vitamin C can increase the risk of aluminum toxicity when it is used with products that contain aluminum. So we always advise the users to separate the dose of medications with vitamin C at least 2 hours. And the recommendation to be aware of vitamin C deficiency, and also the recommendation to enhance intake of vitamin C, is also due to these issues. Vitamin C can be lost from food if they are exposed to heat, and we know that nowadays the preparation of our food always involve exposure to heat, right? So it is highly possible that the content or the amount of vitamin C in our food is lost during exposure to heat. And also some vitamins are also leached out from the food into the cooking water. Yeah, so this table shows the amount of vitamins that leach out from the food into the cooking water. So relying relying to our food entirely for vitamin C may sometimes be a little bit challenging, and therefore dietary supplements sometimes may be beneficial for people. So next is vitamin B complex, which is also crucial for pregnant women, for lactating women, and even young children also require vitamin B to some extent. So vitamin B, we understand that we mostly associate the vitamin with the production of energy, right? So that is why vitamin B is always promoted and marketed as dietary supplements that can increase our energy for busy people, for people who are active in sports, and so and so on. So this vitamin B is mostly associated with increased energy production. So these are some of the symptoms that we know regarding vitamin B deficiency. And again, if you encounter pregnant women, lactating women who present with these symptoms, maybe we want to think about vitamin B deficiency. So pregnant women, lactating women who looks fatigued, who has leg weakness, who are always tired. So these are the type of people who may be deficient in vitamin B, and therefore we want to advise them to increase their supplementation of vitamin D. So these are some of the people that we may recommend the use of vitamin B, and one of them are, of course, pregnant women and also lactating women. And vitamin B, of course, have a role in the development of a baby and also the growth of children. So we may want to pay more attention regarding vitamin B intake among our I can say patients. Yep. So again, we need to know that vitamin B may be deficient in persons with diabetes who is taking metformin. So metformin is a medication that is used to reduce blood sugar level in diabetes patients. So long-term use of metformin is associated with vitamin B12 deficiency. So, so what is the reason why I want to highlight this is we know that there are a lot of women out there are also diabetic, and they are also pregnant. So we want to ensure that if they are using this drug, we may want to supplement them with vitamin B12 as well. And there are also a lot of women out there who are taking oral contraceptive before decide, maybe they have been taking these medications for a very long time, and then maybe they stop using it to conceive and to be pregnant. But long-term use of oral contraceptives is also associated with decreased vitamin B level in the body. So these are also people who have history of taking oral contraceptives are also a good candidate to take vitamin B supplementation. Again, we are not only talking about the benefits of these vitamins, we want to talk about the potential risks of these vitamins as well. I mean, the potential adverse effects of this vitamin. And like all other vitamins, vitamin B also have adverse effect. For example, vitamin B6 may cause tingling, burning, numbness, and these are the adverse effects of vitamin D. And if our patients are taking these vitamins and experience these symptoms, we may want to consider stopping the supplementation before and ask them to see their doctor. Okay, and also vitamin D has interactions with medications as well. For example, B6 can have interactions with certain medications such as levodopa, which is medications used for Parkinson, and phenytoin, medications for epilepsy. Just to keep in mind, yeah. So next is folate or vitamin B9, and we know that this is an important vitamin to be taken by pregnant women. And the recommendation is to take daily supplement containing 0.4 to 0.8 milligram of folic acid per day for women. For women who are planning or capable of pregnancy. And this is a grade A recommendation, which means that it is highly recommended for all women. And we know that women who did not have adequate intake of folic acid will result in babies with non-optimal growth. And again, folic acid, we need to be careful as well, especially those who are taking a drug called methotrexate, because these interactions is actually a good interactions. Yeah, some interactions are bad, and some interactions are not good. Sorry, some interactions are bad, some interactions are good. So folic acid is also used in patients who are taking methotrexate because it can prevent the adverse effects of toxicities from methotrexate. And like I mentioned, vitamin D can cause adverse effects as well. So this is one of news clippings that I got from the internet that showed this one person who used vitamin B lost his ability to walk. So we always, so the recommendation is always monitor your patients if they are taking vitamins, all sort of vitamins, and monitor if they have experienced any adverse effects. So next is fat soluble vitamins. So we know that there are a different kind of fat soluble vitamins such as vitamin E, vitamin A, vitamin D, vitamin E, and vitamin K. And these vitamins are also important for pregnant women, lactating women, and also children to ensure that they have optimal growth. So vitamin A, what are the functions of vitamin A? So it helps our cell grow and develop. It supports the vision. It supports the immune system. It supports the healthy development of the baby. So you can see that all of these benefits of vitamin A actually are important for the growth of a child. Okay, so vitamin A, there are a lot of sources of vitamin A, including from animal, and this comes from eggs, from dairy products, and from liver. And it can also contain in plant products, especially those in orange and red color. Again, we need to be able to identify vitamin A deficiency among our patients. So this is one of the symptoms of vitamin A deficiency, in which they have this follicular hyperkeratosis on their skin. Okay, and they also have night blindness. So at night, they couldn't really see well. So these are the symptoms of vitamin A deficiency. And if we've met or encounter a pregnant woman, for example, who is having these symptoms, we may want to talk about their vitamin A intake. We may want to talk with them about vitamin A supplementation. And like other vitamins, vitamin A can also interfere with drugs. So some people may be taking Orlistat, which is a drug for weight loss, and this drug can interfere with vitamin A absorption. And some other medications include the bile acid sequestrants. Bile acid sequestrants is medications used to reduce cholesterol in the blood. So if a patient is taking bile acid sequestrants, we may suspect, or we may anticipate that there is interactions between the use of vitamin A and also the drug. Other than that, vitamin A can also increase the effect of retinoid drugs. Retinoid drugs is mainly used to treat acne. So if the person is taking retinoid drugs, we want the person to avoid concomitant use. In fact, retinoid drugs is not recommended for pregnant women. Yeah. So this is the vitamin A recommendations for babies. You can see that for babies aged 0 to 12 months, the recommended intake is 350 microgram per day, and it increases as the child gets older. Next is vitamin D. Vitamin D is also important for the development of the fetus. During pregnancy, it is important for the development of a child because it is involved in the development of bones and also muscle. And we need to remember that vitamin D, if we do not have enough vitamin D, it would affect the ability of our body to absorb calcium, which is another mineral that is important in the development and growth of a child. We know that vitamin D can be obtained from sun, and there are a lot of other food products as well that contains high amount of vitamin D. Okay, so these are some of the symptoms of vitamin D deficiency. If you want to recognize this among your pregnant women clients or customers or patients, the symptoms include mood changes, bone loss, muscle cramps, fatigue, bone and joint pain. These are some of the factors of vitamin D deficiency. If they are older, if they are housebound individuals, if they are overweight and obese, all of these could increase their risk of vitamin D deficiency. So this the recommendation for the treatment of vitamin C deficiency is to provide a supplementation of 3,000 to 5,000 IU of vitamin D3 for 6 to 13 weeks. And this is recommended to treat moderate to severe deficiency. Yeah, so this is basically to show you that there are various sources of vitamin D, including the food, the supplements, and there are also a lot of factors that can decrease the absorption of vitamin D in our body, including the use of drugs. Some drugs can increase the absorptions of vitamin D, and some drugs can increase and some drugs can decrease the absorptions of vitamin D. And these are the recommended daily intake of vitamin D. We can see that from 0 to 12 months, the recommended intake is about 400 IU per day for both male and women. And we also can see here the recommended daily intake for pregnant women and lactating women. So in terms of minerals are also important for the development of fetus and also a child. There are many types of minerals. So we have micro minerals that are recommended to be taken in higher amounts, such as calcium, phosphorus, magnesium, sulfur, sodium, potassium, and chloride. And then there are also micro minerals that are recommended to be taken in an amount of less than 100 milligram per day. And these micro minerals include iron, zinc, copper, iodine, fluoride, manganese, selenium, chromium, and molybdenum. But the micro minerals that are mostly important for pregnant women, for lactating women, and also for a growing child is iron and iodine, and also zinc. So we may want to focus on these nutrients to be increased in the diets of those individuals that I mentioned.
Sir Sazwan?
Yep, we have 10 minutes, yeah?
Okay, 10 minutes again.
All right, that's fine. Thank you for reminding. And then, yeah, calcium. We know that calcium forms and keeps strong bones and teeth. It helps with our nerves. It helps our muscle contract. It supports blood circulation and helps our body to release hormones. And that is why it is important for this nutrient to be adequate during pregnancy, during lactation, and should be adequate in the diet of a child. And we know that low calcium are associated with osteoporosis, hypertension, preeclampsia, and eclampsia. And during pregnancy, preeclampsia is common, and vitamin and calcium supplementation can help with this. And calcium and vitamin D, we know that it may reduce the risk of fracture and mortality in the elderly. And there are also some drugs that can compromise the calcium and vitamin D status, and some of these the most common drugs that can compromise calcium and vitamin D status is corticosteroid. So and thiazide diuretics, if it is used by the patient, may increase the risk of hypercalcemia. Okay, it increases the level of calcium in the blood. So we need to be aware of that as well. So these are the recommended intake for calcium for age 0 to 6 months is about 210 milligram. And you can see that the recommended amount for pregnant women is much higher than those who are not pregnant. Yeah, because we know that this mineral is very important for the development of the fetus. And these are some of the sources of calcium. We are fully aware that milk contains high amount of calcium. Yogurt contains high amount of calcium. We can get calcium from cheese and some vegetable products as well. And iodine. Iodine is also important for pregnant women and for the development of a child. And it is recommended for pregnant women to consume about 220 microgram per day of iodine. And these are some of the these are the recommended iodine intake for children, for pregnant women and lactating women. And we can see that also for this for iodine, the recommended intake is higher in pregnant and lactating women compared to those who are not pregnant. So why iodine is important? It is essential for healthy functioning of the thyroid gland, as iodine is needed for the production of hormones thyroxine and triiodothyronine. And these hormones influence the growth, maturation, thermogenesis, oxidation, myelination of the central nervous system, and development and metabolism of all tissues. So this is why these nutrients is very important for pregnant women, lactating women, and in children. So if it is inadequate, it is possible that the growth of the child would be affected. So there are many sources there are many food that contains high amount of iodine, and these include potato, boiled eggs, beans, tuna, iodized salt, shrimps, and seaweed. And it can also be obtained from dietary supplements product that you can found it in the pharmacy store or in health store. So next is iron. Iron is also very important for pregnant women. And it supports the healthy growth of a child as well. And it delivers oxygen to our body, maintain energy levels, and keep oxygen in the muscle. So it is a very important and crucial nutrients to be taken by pregnant women, lactating women, and also growing children. So again, I like you to recognize the symptoms of deficiency of iron, including shortness of breath, fatigue, weakness, palpitation, headache. So these are all the symptoms of iron deficiency. And if you could recognize this, and if you encounter pregnant women, for example, who are experiencing these symptoms, you may want to talk with them regarding the iron deficiency and the use of iron supplementation. And these are the recommended daily amount of iron according to age. And again, we can see here there is an increase. The recommendation is to have an increased intake of iron for pregnant women and breastfeeding mother. And this high intake of iron during pregnancy and breastfeeding could help with the development of the fetus or the baby. And zinc is another important nutrients. Like iron, it also supports healthy growth and development. It supports immune system. It helps forms our genetic materials, and that is why it is so much important for the development and growth of a child. And it can be obtained from animal sources such as shellfish, meat, and can also be obtained from plant products such as mushroom, legumes, and whole grain. And these are the recommended daily intake for children and also adults. We should be aware that these the recommendation is different between males and females. Yeah. Zinc deficiency is commonly seen in alcoholic people, those who are using alcohol. So we need to be aware of that. And diabetic patients are also commonly have a zinc deficiency. So if we have a woman who is diabetic, we may want to think about zinc deficiency. If they have, if they experience frequent zinc deficiency symptoms, we want to check on that, and maybe we want to consider zinc supplementation for them. And there are also a lot of medications that can interact with zinc. Some medications include ACE inhibitors, angiotensin receptor blockers, anti-thiazide diuretics. These drugs are drugs that are used for hypertension. Okay, so this drug increase urinary excretion of zinc, so there may be a need to increase the intake of zinc in these people. And long-term supplementation, we need to be aware that long-term supplementation of over 50 milligram per day may result in copper deficiency. So in short, we want people to take adequate zinc intake, but we don't want them to take too much. All right. So just to share an experience that I have with a patient that I have encountered, they use these products. You can see that this product contain 12 milligram of zinc, and the recommendation is to take 2 to 6 capsules per day. And this patient actually take 6 capsules per day. And then on top of that, this person also take another supplements which contain zinc 30 milligram. So we know that this person has already taken too much vitamin, too much zinc in a day. So we want to advise this person to take the proper amount of zinc per day. So in terms of specialized food supplements, there are also many products out there that have been developed to increase nutrition for children and also pregnant women. So products such as ready-to-use foods, micronutrients powders, this has been developed for this purpose. So one of the example is ready-to-use supplementary food paste. It's a high-energy fortified food used by humanitarian agencies, ministries of health, governmental and non-governmental organizations. And it targets children 6 months and older suffering from moderate acute malnutrition. And we also have micronutrients powder that contains essential vitamins and minerals. It comes in sachet, and it can be used for children aged 6 to 59 months. And but the primary target is children aged 6 to 24 months. So this is target for products for children who have malnutrition. So this is how micronutrient powder is provided to the babies. And also we have with soy blend, and it targets young children aged 6 to 59 months. And it can be used as a complement to breastfeeding, but it's not recommended to replace breast milk. All right, I think I'm on time. It's 11:20. So that is all from me from a perspective of a pharmacist. I hope that the content of this presentation could provide with you a little bit of new information regarding dietary supplements that can be used by pregnant women, lactating women, and also children, so that we can reduce the incidence of stunting. Thank you very much, and I pass it back to the Masters of Ceremony.
Terima kasih, Sir Afwan. Nice information and interesting presentation. So you should stand by on Zoom because the panel section will in the end of the session. So okay, I was informed the committee, the panel discussion move to the end of section because we have a limitation time. Okay. Hello. Halo. Hai. Masih semangat ya? Ngantuk?
Halo.
Okay.
Masih.
I have
Masih, Pak.
wish your mind and your physical is still synchronized. Yeah. Okay. We have 2 special speakers. Yeah. To presented from STIKES Telogorejo, your beloved lecturer. Please welcome Apoteker Anipatusada dan Nurse Siti Lestari. Big applause. Okay, yeah. And then this second section, both of you to present it, your subject. Yeah. First section will be presented by Miss Anif. Miss Anif, how do you feel? How do you feel? You look like really anxiety. Please take a deep breath. Exhale, inhale. Okay. 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 Before start the presentation, I will read the curriculum vitae of Miss Anipatus Saada. Please, the committee. Okay. Yeah, Miss Anipatus Saada is alumni of Bachelor of Pharmacy from Yayasan Farmasi Semarang, STIKES, in 2018, and she has completed to her apothecary program in 2019. She continued to Master of Pharmacy in Muhammadiyah Surakarta University with specialistic in pharmaceutical science. She has been a pharmacist with the program lecturer at STIKES Telogorejo Semarang for 1 year. She has done other research in 2021 until 2023, and the research topic in her area expertise. Some publication can be tracing in Google Scholar are Grand research from STIKES Telogorejo Semarang, effect of different solvent or kawista, bark extraction. Grand research from STIKES Telogorejo Semarang, pharmacological effectiveness test, anti-diabetic pharmacokinetics, profile and structure elucidation of moringa leaf ethanol extract, ICB Pharma 2021, inhibitory activity of a glucoside enzyme by albumin, isolate from giant gurami, rice eel, and mackerel tuna. So, Miss Anif, I will give you 20 minutes for the presentation, your subject. The time is yours.
Okay, thank you, Mr. Gilang. Hello, everybody. Masih semangat ya? I want to talk in here about prevention of stunting. Yes. Assalamualaikum warahmatullahi wabarakatuh.
Peter, can you help these tools to make an... Okay. It's the work, Miss Anif. Please.
Oke, untuk sampai saat ini, ya mungkin dengan bahasa campuran ya. Do you understand about stunting? Yes. Oke, berarti nggak perlu ya saya lanjutkan lagi ya. Okay. No, yes. I want to start the presentation. Okay, what is the stunting? Yeah, we must know. Yeah, we have know about stunting. Stunting is a chronic malnutrition problem that begins in early childhood and causes growth retardation, resulting in children being shorter than they should be for their development age. Yeah. Next. Okay. Stunting in prevalence Southeast Asia. Yes. According to UNICEF, the World Health Organization, and the World Bank show that 27.5% of the children under the age of 5 in Southeast Asia are stunted, and 8.2% are malnutrition, and 7.5% are overweight. It is estimated 1 in every 2 children in the region has at least one micronutrient deficiency. In Indonesian data of January 2023, the stunting prevalence in Indonesia will decrease from 24.4% in 2021 to 21.6% in 2022. The risk factor of stunting, according to Kemenkes 2023, the risk factor for stunting include income, economic, social status, environmental sanitation. The family's economic status greatly influence the family's purchasing power. Yeah, access to adequate for education, quality health services, and meeting adequate for food, and then the maintenance of healthy, for get healthy, it's very easy and very good because they have family's economic status. And then the children who come from low family economy status have a higher risk of experiencing malnutrition. It can be stunting. Environmental sanitation, it has important to the role of our human life. Water is very important in life. Using clean water in the family will prevent various diseases such as diarrhea, typhus, and other, and a poor personal hygiene. It can be at the risk of increased infection disease. To support the macronutrients, we can add the natural nutrition. Yes, the role of pharmacies in stunting management. Number 1 is macronutrients. We need a large amount by the body. The example is carbohydrate, protein, fatty, and fiber. And number 2, about micronutrients, needed a small amount but essential for the body. The example is mineral and vitamin. The micronutrients intake needed to overcome stunting include number 1, zinc. Micronutrient deficiency is stunted growth with special attention to the effect of zinc deficiency. Zinc deficiency at school age will result in impaired physical growth and impaired brain cell development. Based on the regulation of the Minister In 2013, the recommended nutrition intake for Indonesia is between 13 until 16 milligrams per day for adolescent girls, while the adolescent boys is 14 until 18 milligrams per day. For the iron intake can impair cognitive function and growth because iron helps the immune system and then making children less susceptible to disease. Inadequate zinc intake will also reduce the production and secretion of growth factor, which can use developmental delays in children. And then minerals, next is calcium, another micronutrients. Calcium intake is associated with bone growth in children. Calcium in the body affect growth in children if the calcium level in the boys is below 50% of the normal calcium value. This condition is related to important function of calcium in the bone mineralization process as well as bone health, especially the formation of bone structure and bone satisfying. Therefore, adequate calcium intake plays an important role in the children's growth, especially as they enter the peak bone mass period. And then vitamin D, observational studies provide evidence that stunting is associated with low vitamin D in children. It can be stunted. Therefore, vitamin D supplement is a potentially modifiable risk factor to prevent to treat stunting, regular further evaluation. The nutrition needs for the children have been presented before. These are examples of plant and fruit that can help prevent stunting. This plant is very easy to find in Indonesia. There is Moringa olivera. You can call the kelot. And number 2 is pumpkin atau bisa disebut dengan labu kuning. Moringa olivera substan, yeah, it has composition, mineral and vitamin. Minerals such as calcium, iron, sodium, and then vitamin have vitamin C and E, and then beta carotene and antioxidant such as flavonoids, phenolic acid, glucosinolate, isothiocyanate, and saponin. The composition also have benefits as active substance in nutrigenomic approach. In addition, have two anti-inflammatory, antioxidant, and anti-anemia effect. The nutrition composition of moringa powder per 100 grams have energy, protein, lipid, and carbohydrate. The composition have to release, helping for preventing of stunting. And then the last for fruits is pumpkin. whereas pumpkin is a plant with many benefits such as vitamins, carbohydrate, and mineral. Benefits of pumpkins is source of energy. A source of energy is also produced from pumpkin. This vegetable also has quite low calories. The low calories is pumpkin are a good source of carbohydrate for toddler. 1 glass of pumpkins is equivalent to 4 grams of carbohydrate. This amount is very sufficient to fulfill energy source in toddler. And then pumpkin is also a low-fat vegetable, which can benefit moms in choosing supplementary foods for children, since it does have many risks. And then pumpkin is a vegetable with a good source of vitamin C. The body also needs vitamin C to form collagen in the skin, blood vessel, joint, and bones. Vitamin C also help toddlers fight infection by boosting their immunity. And then benefits pumpkin, improve toddler digestion. Pumpkin also contains fiber, which is good for digestion and absorption of nutrition. Keeping the toddler's keeping the toddler digestive tract smooth and preventing contraception. To meet their fiber needs, toddlers need to consume at least 10 grams of fiber daily. Pumpkin also contains fiber, which is good for digestion and absorption. And then the benefit loss of pumpkin is support brain and nerve growth. Iron, when pumpkin have contain iron and folate intake is necessary after the toddler is born. In general, folate and iron intake can be obtained from eggs and meat. However, the nutrients in pumpkin are very important for toddler. Toddler's body is in dire need of the nutrients in pumpkins. So the intake of flotation in the production of red blood cells becomes normal and prevents anemia. Folate plays an important role in the normal development of a toddler's brain and nervous system. I think that's all of my presenter. If any question, you can say in discussion. I think, thank you very much for your attention.
Big applause for this one. Nice presentation and very interesting. So the conclusion is how what's the difference between vegetable and fruits? Because you said pumpkin is vegetables or fruit. What's the difference? It's still confusing me. Pumpkin is still fruits. Oh, okay. Okay, thank you. Yeah. Not fruit, we can mix fruit and vegetable. Okay, thank you once again to Ms. Hanif to the presentation, nice and interesting. And the last speaker is Ms. Lestari, before she start the presentation. Let me introduce herself with curriculum vitae. Okay, Miss Siti Lestari is an alumni of Bachelor of Nursing from STIKES Telogorejo Semarang in 2020. Yeah. And she continued to her master education in University of Indonesia with scientific specialistic pediatric nursing in Jakarta. She has been a nursing program lecturer at Telogorejo Semarang for 5 years. She has done to each other research in 2015 till 2023, and the research topic in her area expertise, some publications are factor that influence sleep quality in children suffering from chronic disease in the Semarang area, proceeding of STIKES Telogorejo 2023, storytelling and cheerful music therapy reduce hospitalization anxiety in toddler, Poltekkes Supraun Malang 2022, and other research. And the last you can see of her many experience, and she also active to broad the popular article. The last article was published in the online famous newspaper with topic community services activities management of stunting in the Karangayu region. Okay, you ready, Miss Lestari? Okay. I will give you 20 minutes. Yeah, the floor is yours.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everybody. How are you today? Yes, I knew you are now very happy, very great, right? Alhamdulillah. Mohon izin, Ibu. Mohon izin. Okay. I'm very glad and very happy to be here with you to discuss about nursing care for stunting children. Sorry. Please wait for a few moments.
Another PowerPoint, which is not from Ms. Lestari. She gives another PowerPoint.
I have another PowerPoint with a new name, Tari, in the after of the title. Please. Okay. Yeah, still waiting, and I would like to give a poem, pantun. Saya tunggu ya Mbak, sambil tak berpantun dulu. Mohon maaf pakai bahasa Indonesia dulu pantunnya. Wayang kulit bawa keris.
Cakep.
Anda semua kembang desa.
Cakep.
If you are a girl, you are kembang desa. But if you are a boy, you are kumbang desa. Right? Oke, wayang kulit bawa keris. Anda semua kembang desa. Memang sulit berbahasa Inggris, tapi saya akan mencoba. Beli es campur ke Tasikmalaya. Jauh amat ya. Beli es campur ke Tasikmalaya. Bahasa campur-campur, it's okay ya. Okay.
Awesome.
The last one. Still waiting soalnya. Satu lagi. Baju saya modelnya tebel. Maju saja modelnya kendel. Yes, this is the right one. Okay. nursing care for stunting children. Ya, saya pakai ini kali ya. Yeah. I'm sorry, the LCD is next. Okay. Stunting among Indonesian children. As we know, stunting in Indonesia is occurred not only in the village and in the remote area, right? But also in the big city like Jakarta, Medan, Surabaya, and also in Semarang. So, in this occasion, I would like to share and discussion about the 3 points. The first one is stunting situation in Indonesia, and the second one is strategies, Indonesian strategies to reduce stunting in 2023. And the last one is nursing care plan for Indonesian. So, this one is the prevalence of stunting in Indonesia. Based on this data, we know that the higher prevalence in Nusa Tenggara Timur and the lowest is in Bali province. So the average for Indonesian prevalence stunting is 24.4%. It's too high. But the good news is the prevalence of stunting decreasing year by year. And today in 2023, we have 17%, and we hope that in 2024, this prevalence is decreased again up to 14%. So in every year, we need to consistently decrease by 3.5%. Are you ready as a health worker to decrease the prevalence of stunting in Indonesia? Okay, if you are ready, let us say a yell together. Say no to, say yes to. Okay, loudly please, one more. Say no to, say yes to. Okay, tambungan to. Yes. Okay, this is the review about the definition of the stunting, but the previous speaker was explaining it. So we would like to move to the next slide. This is the acceleration intervention to reduce stunting in 2023 by the Ministry of Health of Republic Indonesia. The Ministry of Health of Republic Indonesia on February was to the socialization to health worker about these strategies, but I would like to be focused on infant to adolescents group. In infant to adolescents group, we are 3 parts of age. The first one is infant 0 until 6 months. In infants 0 until 6 months, the most important intervention are, the first one is providing immunization. The providing immunization is most important for children in Indonesia to eliminate case of stunting, right? So as a health worker, do you agree if our responsibility is to give, educate, and promoting to the parents about the immunization? Do you agree? Yes, I think you are all agree about it. So the second one is giving exclusive breastfeeding. The exclusive breastfeeding is the most important one. So we should be able to educate and giving promotion to the parents to giving exclusive breastfeeding, to breastfeed exclusively. Sometimes we as a health worker, if you are for the next step, you are working. So yang ada di sini, halo. Okay, you will be a worker in healthcare, right? Right. So if you are a health worker for the next time, you should be able to be a role model to giving breastfeeding for your child, right? Although maybe you have too busy time, but you should be able to have time to giving breastfeed for your child or doing pumping, etc. So our responsibility too to promote this usual role to the parents to giving breastfeeding exclusively. So the second is infant 7 until 24 months age. So the most important in this part is providing additional food. This baby on this age is getting weaning food, right? And in the previous time, we know that protein hewani, or we know that organic protein is important to reduce stunting. But now in 2023, the most important sources is animal-based protein. So in every district, in every kelurahan, we have cadres. In every morning, the cadres going to the house by house to giving the animal-based protein to the child with stunting. It's as a way to reduce the prevalence of stunting too. And the last part is adolescent age. In the adolescent age, we should be able to administer FE tablets and also check the hemoglobin every 6 months or every years, right? So if this thing is occurred or detected, or we get the children with suspect of stunting, we should be able to do education to the parents to going to the referral hospital to manage by the referral hospital. Okay, this is about Indonesian nursing research special for immunization. Based on this research, exploring the relationship between immunization and stunting, immunization prevents stunting. So the results show a significant statistically relationship between immunization status and stunting occurred among children. And then children who receive incomplete immunization have a 1.2 times greater risk of stunting compared to those who receive complete immunization. So it's very important too. And the next research is about breastfeeding. The title is Exclusive Breastfeeding Protects Young Children from Stunting. And based on this research, exclusive breastfeeding protects low-income children against stunting. So it's very important. We are, as a healthcare provider, should be able to give promotion to the parents about the exclusive breastfeeding. And now, this is the research about additional food, especially for animal-based protein related to grow, based on the literature review result that stunting is important to the quality of generation, and we as a health worker should be able to provide information to policymaker and agencies in the country concerning to education related to high nutrition local food. So local food is important to be able to do the promotion to the parents as using local food as a source of nutrition for her or his children. And now we will talking about the community development activity. And the government have many programs to reduce the stunting. As number one is Isi Piringku. We know all about Isi Piringku slogan. Isi Piringku is a slogan from the government to make sure that the plate is full of source of nutrients such as carbohydrate, protein, fat, vitamins, and minerals. Okay, and the second is PMT atau kita kenal dengan additional food, ya, pemberian makan tambahan, especially for providing animal-based protein. Yeah, the cadres in every morning going to house for the children becomes with stunting to giving animal-based protein to reduce prevalence of stunting. And the third part is Posyandu Balita for screening, growth, and development. So, in the Posyandu Balita, we have cadres too. And we should be able to educate the cadres to do the best way to screening to the children by the good measurement. Okay. And Germas, etc. So, besides it, STIKES just have community development activity too. We have been do slogan by Pohon Ranting Kayu. What is that? Pohon Ranting Kayu is an acronym for PHBS dan pola asuh. It means healthy living, clean behavior, and parenting skills. And then O for optimalisasi tumbuh kembang. It means optimize growth and development. The next one is H for hygiene and hypnotherapy. It means hygiene of sanitation and hypnotherapy. The O is optimize healthy. It means optimize healthy life for the children with stunting. And the last one is N for ngerti gizi or promoting the nutritional needs. Ranting means gerakan anti-stunting. We yell it to the kelurahan, district, and to the parents who have stunting children. Kayu for Kelurahan Karangayu because it held in Kelurahan Karangayu. Nah, it's the picture about the government program in Indonesia about to reduce stunting, such as Isi Piringku, giving PMT, Posyandu, etc. So in the next picture is our activity, community development activity for promotion and education to the parents and children with stunting cases in Kelurahan Karangayu. We discussed much more there. And the next is hygiene and sanitation. So we are cleaning the house of children with stunting house to house up to now. So we have tim kintlong, we call it tim kintlong, for cleaning the house. And we also doing cross-sector collaboration to eliminate stunting. We collaborate with Bulura, cadres, cleaning service, etc., to make sure that our program is continuously going. Now, this one is about hypnotherapy. Hypnotherapy is giving for the child who will not eating properly. And up to now, we doing monitoring and evaluation to the family and the child with stunting in this place. So this one is about nursing care for stunting among Indonesian children. As we know, we have 5 steps in nursing care plans before implementation and evaluation, that are nursing assessment, nursing diagnosis, and nursing intervention. The first one is about nursing assessment. As a nurse, we should be obtain accurate anthropometric. Okay, thank you for the remaining segment. Obtain accurate anthropometric measurement, and we should be able to do for the children below age 3 years without shoes and unclothed. So this is the measurement to detect stunting using the WHO curve. Blue is for boy gender and pink for female gender. And we should be able to giving plot here properly. This is the different types of undernutrition. As previous speaker explained it, there are 4 parts of undernutrition, and I will go into the next slide. This is nursing assessment tool. We should be able to make sure that when we doing head circumference measurement, please make sure if there is no overlapping, but make sure the insertion is right. And the measurement should be plotted in this chart. We should be able to see the plot before and plot now. Is there rising or not? If it's not rising graphic, we should be able to educate to the parents, and it's be warning for us. So we should be able to obtain nutritional history regarding the eating patterns too. So this is about the nursing assessment to observe parent-child interaction. So while we doing measurement, make sure that interaction parent and child is good. If not, we should be able to do education for them, how to give best communication, best interaction between the parents and the children. So it's possible observe the parents feeding the child, assess child's overall tone, sucking pattern, oral sensitivity, lip and tongue function, and swallowing ability too. And next one is assess neurological and cardiovascular status for alertness. attentiveness, developmental delay, cardiac arrhythmias or murmurs, and the next one is assess skin hair and musculoskeletal system 2, and assess developmental status using the refer to development tools as indicated. This is the nursing diagnosis for children stunting. The first one is imbalanced nutrition, less than body requirements related to inadequate intake, and second one is delayed growth and development related to the malnutrition, and the last impaired parenting related to inability to meet the needs of the malnourished child. Okay, what we will do with children with stunting, the first one is promoting adequate nutrition, develop individual teaching, and then provide a quiet, non-stimulating environment for eating, demonstrate proper feeding technique, and the last one is administer multivitamin supplement as prescribed. And the next one, nursing care plans also, you can read by your own in the home because of the time is limited. So encourage nutrition, etc. And the next is promoting adequate growth and development, obtain accurate weight at every visit of every day is hospitalized, assess child growth by using age and gender appropriate growth chart with using WHO, and encourage period of scheduled rest and sleep. The schedule of rest and sleep is very important for the parent because sleep is related to children, to willingness of children to eating. Promoting effective parenting. Effective parenting skills is important too. And the next is community and home care consideration. If we are the community nursing, we should be able to do community and home care consideration for children with stunting. And the expect outcomes. The first is increase height and weight steadily and attains developmental milestone at an appropriate age. And the last is parent participating in childcare using appropriate feeding technique. Okay, we should be able to raise these outcomes to decrease the stunting prevalence. We should be able to family education and help to do family education and health maintenance too. Giving reinforcement consistent with feeding, encourage parents, advise the parents to introduce new food slowly, review the importance of providing routine rest schedule, reinforce the need for follow-up care with child visit and also immunization. Okay, one more. Let's say together, say no to, say yes to. Yes, it's our responsibility. Thank you very much for the opportunity. Yeah, and we hope our responsibility for the children with stunting is doing well, so we can improve the quality of life in children with stunting. Thank you.
Okay, thank you, Ms. Kari, for informative and interesting presentation. Okay, we final the end of the session. Yeah. As I mentioned before, we have a limitation time, so I will give you to make a question for this participant who attending in this room. Just 2 questions. If you have any question, please raise your hand. Anyone? Okay.
Hello, my name is Dia Novita. I'm from Erasende. I want to ask to all the speakers about the father's role in the communication with children in preventing stunting. Because we live in Southeast Asia, the father role in the child development is not very good. So they fathers tend to leave the education and childcare to the mother. So how do we, as a healthcare, be able to encourage fathers to be more involved in child development? Thank you.
This question for Miss Tari or okay? Okay. Okay. Maybe this question for Madam Afwan, yeah.
Oh, okay. Thank you so much for this
Please, Madam
question.
Afwan.
Yeah. Actually, in Thailand and Indonesia, we may have the similar situation that father have less involvement in caring for children, and the role of take care of children is based on the mother. So, and right now the mother work outside, so their responsibility to take care of the child has some limitation. Therefore, how in case that we have the problem with child health and development, how can we improve the father involvement? First of all, when the child come to the clinic, we assess who is the primary caregiver. And right now, we found that the primary caregiver at home may be grandparents. That means they are older and have some limitation in caring for children. And the second, we will assess how can we involve father in the in caring for the program. And most of these, we try to provide information direct to the father. For example, we use the telehealth to communicate with the parents, with the father, because some father come to the clinic with the mother. It's easy for us to communicate and booster, empower them to take care of the children. The second one, we use, as I said, that we use telemedicine to communicate. The third one, in Thailand, we have the health volunteer that work in the primary care setting. Health volunteer trained to be healthcare specialists. There might be the people in the community, and we invite them to be the volunteer. So they are trained to encourage the family, assess family. Some specific program direct to the healthcare volunteer to employ the program to the target population. So that might help.
Okay, thank you, Madam Afwan. Is it clear answer?
Yes. You want more information, or is it? Do I answer your question?
Yeah, it's really good, Madam. The answer. Okay, someone another question for the participant in this room? Another? Okay. We will wait. Maybe let me read the question from the participant on Zoom platform. Yeah, it is two question. Yeah, from Miss Sutarmi, affiliation Politekes Kemenkes Semarang. The question is, I am interested in program for school age about calculating program. Would you mind to explain a bit detail how to implement this program? Is there any specific from your calculating program? This is question for Miss Apawan, Madam.
Okay. The calculating program. Let me show this a little bit. Let me go back to my PowerPoint and I will show you what does it is. Let me see. Okay, it might be it take time. It might take time to open it, but I will give you some explanation a little bit. That is the program that put on the Excel, and this program, the Nutrition Institute in Thailand at Mahidol University created it and send it to use around the school and the healthcare in Thailand. And this is kind of formula that they use to calculate. Let's see. I think I will show the. Let me show the program a little bit. It might help. Excellent. Okay. Share. Can you see this program?
Yes, Madam.
Okay. And let me move a little bit. Okay. This program, this one, they put the child, gender, birth of date, and the day that they measure the weight and height, and this program calculate to be the and put the weight and height. So they is similar to plotting this information in paper, but this paper come up with the idea that they do not need to use the paper base, but from this they interpret the result like gender 1 equal to boy, age, this column is age, they calculate its weight and height. From this, let me translate in English. It says that weight per age, this one height per age, and this one weight per height, because of their formula under the Excel. And the next one is this one is a report. This one is a report that all of the children in school, how many of them that come in to measure this. Then right now we put the information in within one children, right? So and they interpret the result. How many of them have the overweight? How many of them stand here higher than normal and stand here is the red line, the red letter here, and they suggest that report this one. right? And this one weight per height, this interprets as obesity and thin. So these are the program that the nutritional institute at Mahidol University create and use it. So I think you may ask the IT department make it for you, and I think it can work. Okay.
Thank you, Madam Afwan, for your answer. It's really clear, and she show how to calculate, yeah, the material. Maybe you can translate to English, Madam. Okay. Okay, thank you, Madam Afwan.
Thank you.
The second question is from Miss Emi Susanti, affiliation Unwahas ITB. Yeah. Question 1, I agree with the World Anti-Stunting Program to improve children's growth and development. Apart from vitamins and minerals, can folic acid also overcome stunting? Thank you. This question for Sir Saswan. Sir?
Yeah. Can you repeat the question?
Okay. Can folic acid also overcome stunting? Apart from
Can folic acid also overcome stunting, right? Yeah, so in my presentation just now, I also have included a discussion on how folic acid is beneficial for pregnant women, lactating women, and also in the development of children. So we know that folic acid is important, especially in DNA synthesis, cell division. So all of this is important for child growth. So yeah, folic acid can be beneficial in reducing the risk of stunting. And there is also a huge study conducted among multiple countries in South Asia. I think the countries involved like Afghanistan, India, I think including Bhutan and some other countries. So this study actually looks at the use of folic acid and iron supplementation among women. And what they found was there was a decrease in stunting among those women who are taking folic acid and iron supplementation. So this is another evidence that we have showing the benefits of folic acid supplementation among women. Yeah.
Okay. I hope this is a so clear answer from Sir Sazwan, Mrs. Siapa tadi? Miss Amy, yeah. Okay. Last question from participant in this room. Enough? Okay, enough. I think you are really hungry, yeah? Because it's time to 11:26. Okay. Ladies and gentlemen, we finally come to the end of part of this section. I would like to take the conclusion from what the speaker have presented, that stunting is currently a major problem in health because the prevalence of stunting continues to increase. Collaboration of healthcare professionals is very necessary for the prevention and treatment of stunting. From the north side, they can identify the case of stunting, reduce risk factors such as promoting knowledge, practice, and child care skills, empowering and increase the health literacy of parents or caregiver. In Indonesia, the government has a program namely Isi Piringku, PMT, Posyandu Balita, yeah, Germas. Yeah, community developmental activity has a slogan namely Pohon Ranting Kayu. Yeah, it's consisting of healthy living, and clean behavior and parenting skill, optimize growth and development, hygiene of sanitation and hypnotherapy, optimize healthy life, promoting the nutritional needs. From the pharmacy side, it can promote the use of micronutrients, those needed in large amount by body, carbohydrate, protein, fat, fiber. Micronutrient needed a small amount but essential for the body, especially mineral and vitamins. Macronutrient intake needed to overcome stunting includes zinc, iron, calcium, and vitamin D. One of the plant that can be used because it rich in vitamins and minerals is pumpkin. Pumpkin is a plant with many benefits such as vitamins, carbohydrates, and mineral, and Moringa oleifera contains minerals such as calcium, iron, and sodium. Vitamin C, vitamin E, beta-carotene, antioxidant, flavonoid, phenolic acid, and glucosinolates. They also have benefit as active substance in a genomic approach. In addition to anti-inflammatory, antioxidant, and anti-anemia effect. Pharmacy role, it's important during the pregnancy to prevent stunting and provide counseling to all use of drugs that are at risk of interacting with vitamins and minerals to reduce vitamin and mineral deficiency. Okay, I like to thank so much to the speaker. Yeah, big applause for all speaker
Thank you.
for informative and interesting presentation, and the two participants that join in the Zoom and attend in this room. Okay, hopefully the seminar will be beneficial for everybody. Amin ya rabbal alamin. See you next ICHPR soon. Yeah, for me, enough. Assalamualaikum warahmatullahi wabarakatuh. Selamat siang.
Let's give warm round of
Thank
applause
you.
to our speakers and moderator. Thank you. Please to take a seat, please.
Thank you so much.
Thank you so much, Prof. Dr. Apawan Nokong, and thank you so much for Dr. Mos Saheswan Abdul Wahad, APT Anifatus Sada, and then Miss Siti Lestari.
Yep,
Next
thank
session,
you.
apresiasi to our very great speakers. We'll giving certificate as a speakers today to Prof. Dr. Apawan Nokong from Mahidol University, Thailand, and then Dr. Mos Saheswan Abdul Wahad from University Technology Mara, Malaysia. Thank you so much. Please give warm applause to our great speakers. And the next section, giving certificate and gift from Dr. Swani to very great speakers in session 1. Dr. Swani, Miss Tari, and Miss Anifatus, please come to podium again, then to giving certificate and gift. Thank you, everyone. Please take your seat. As a special highlight of today international conference, we have a range of mesmerizing traditional dance performance. Let's embrace the rich cultural heritage with a performance of Mayong traditional by our talented student dancer in STIKES Telogorejo Semarang. Let's give warm applause to traditional dance performance. Our moderator, Nurse Nimade Ayulansari, Magister Keperawatan, and letting me read the CV of Miss Nimade. Name, Nurse Nimade Ayulansari, Magister Keperawatan. Was born in Semarang, Central Java, education background, Magister of Nursing in Universitas Pajajaran in 2019, and money research and community services about nursing and constabule for the last 5 years. Without further ado, I invite Master Miss Nimade will guide it in seminar session 2. Let's give one round of applause to our moderator in session 2. Thank you.
Okay, good morning all. Are you still here? Okay, we have a second session and I would like to introduce myself. My name is Nimade Ayulansari and I would like to lead the second sessions. As like the first sessions, we have an expert panel and also discussions. Okay, are you ready? Okay, for the speakers in the second sessions, Mr. Yao, are you still in Zoom? Mr. Yao?
Yes, I'm here.
Okay. Are you hearing me clearly?
Yes.
Yeah, we are going to the second session with you. So, Hao, ni hao ma.
Ni hao, hello, thank you.
Okay, we are going to explain your curriculum vitae, please, for the curriculum vitae. Okay, before I explain the curriculum vitae, I would like to explain the rules of the second sessions. For the Mr. Hao and Miss Madam Melin, you have 30 minutes to explain your material, and for Miss Tia and also Miss Ragil, you have 20 minutes to explain your material. And after that, we have discussions, 20 minutes. Okay? Hi.
Okay.
Let's focus to here, right? Okay, thank you. Okay, for the second sessions, we have Mr. Yao Simpson, Director of Food and Physiotherapy Clinics.
Okay.
And
so I will show you my screen, yes?
okay. And for his expertise is pediatric physical therapy. And Mr. Yao will explain about the providing exercise in order to improve life quality of child with growth delay. Are you ready?
Yes, yes.
Okay, time is yours. You have 30 minutes.
Okay. Okay, good afternoon, everyone. I'm Yao Qin Zhang. I'm a physical therapist in Hongguang University from Taiwan. I'm very excited to share you to this article. So my major for you, I have to show you the information is about providing exercise in order to improve life quality of children with growth delay. So I already working for special kids already for 10 years, and I have met a lot of stunting children. They may have some kind of developmental problem. So as we know, in this morning, we learned a lot of about stunting. So now just let me introduce just a little bit. Okay. Okay, let me check. Okay. Sorry, is my screen still there?
Not yet.
Here?
Not yet. We
My
cannot
screen.
see your material.
Okay, one more time. Okay, so how about now?
Yes, we see
Okay,
it.
thank you. Okay, I'm sorry. Yeah, so in this morning, we learned a lot of issues about stunting. So according to WHO, the standards about stunting is mean if the children's height for age, this score more than 2 standard deviation use age and sex specified, we call, they may have high risk for growth delay, then we call stunting. And out of this world, we can see this picture from WHO in 2023. As we know, since 2000 years to now, 2020 years, we can see the prevalence about stunting children. They from 33% decreased 22.3%. That's a good thing because we know the stunting children in this world is already decreased, but it still is a very important issue for us. We have to pay attention on it. And what is the reason to cause the stunting children? So in the article from Daniel from 2016, the article tells us they have a lot of risk factors to cause stunting children. The major point, the major risk factors is fetal growth restriction and preterm birth. That's very high numbers, high amount in this world. And second is environment factors and mother nutrition infection and children nutrition infection in this world. So for now, even we have a less stunting children, but we still have some issue have to take care about these kind of children. Okay, so according to the result, we can see, we understand they have a lot of issue to cause stunting children. For according to the information, we can understand what is the 2 major points to cause stunting children. The first is maybe that is a familial genetic and constitution problem. But this is very difficult to change for stunting children because the genetic problem is very difficult to change for stunting children. But second hand, the stunting children may have a severe and probably treatable disease. That means the stunting children may have a growth hormone problem like deficiency, or they have some idiopathic short status like ISS. This problem for stunting children we can help them to change their life to improve their situation for now. So according to this article, we can see in this situation for stunting children, we can see a lot of problem, a lot of issues for them. Maybe they have some endocrine disorders for the stunting children. They have some reason about this. So they have some body high risk, high problem for them. And in this article, in Husha A in 2017, they say the endocrine disorders, they have a 26% for children to cause them have a short status etiology. That's mean we call the stunting. And they have 11.8%, they have GH deficiency. That means growth hormone decrease. So today I'm gonna focus on GH deficiency for the stunting children. Okay, in this morning, we learned a lot of knowledge about GH, the stunting, but now I'm gonna introduce again from physical therapist's view. I want to introduce how GH secretion for the stunting children. So the first if our human being, we have some stimulation like a physical stress, sleep, or hypoglycemia, exercise, and protein, they will stimulate our pituitary, will squeeze GH hormone. And the GH hormone, growth hormone, will increase our body to repair our tissues or organs, and GH also will improve in our livers to improve IGF-1. And that's why we have a GH, just growth hormone, that's growth hormone. But sometimes the somatostatin, that's GHIH, sometimes like a hyperacid or hyperglycemia, they will decrease our GH screens. So that's a negative effect for our body. So according to the article, we can know in our human being, we have 4 different hormones mediating linear growth of children. That's androgens, growth hormone, usually like growth factor 1, and thyroid hormone. That will help us to be growing up, to make our body weight getting higher. So that's the reason. Okay, so for now, we understand the reason, mechanism why the children, stunting children, they may have some issues about the short status. And they have the other problem or complication because of stunting? Some article tell us, yes, they may have some complication for the stunting. The first, like they may have loss of physical growth potential, and they may reduce neurodevelopment and cognition function, and they may elevated risk of chronic disease in adulthood, and they may increase risk of morbidity and mortality, and then maybe increase their risk of obesity, and they may have a motor developmental delay for the stunting children. Okay, so today I'm gonna focus on motor developmental and their physical issues because I'm in physical therapy. I'm major doing that. So I want to share you for some new information about exercise and stunting children. So according to 2022, Takin author, they give us a very special article. In this article, they including so many special kids, like stunting kids and normal no stunting kids children, all of subjects like 300 subjects. And the author just use some tools like Denver 2. The Denver 2 is a special tool for screening the children if they have a developmental delay or not, that screen tool. And second, they use CAT. The CAT is cognition tool, just to check the children they may have a cognition problem. And CLAMS, that means is also about cognition and language and audio milestone scale. So the author just including 300 children, 150 is no standing, 150 is standing, and the children's age between 1 to 3 years old. And they find the children if they are standing. In Denver 2, the developmental check, they find the standing children, they may have high risk for developmental delay. And also they have a high risk about cognition delay. So for this study, we can see the stunting children, they may have a developmental and cognition delay with the other normal children. Then the other interesting article for us is introduced about if the stunting children, they're getting up, they go into teenager, what happened for them with normal children. So in this article, the author, they just including 7,918 subjects, and their age from 6 years old to 15 years old. And as you can see the table, the baseline is about age, the children's age. And the vertical line is about the test, the outcome. Some outcome like a muscle strength, like standing, long jumping, or hand grasp. That means the muscle power of your hand or your leg. And the inferior one is a 15-minute run, and the shuttle run, that means the children's physical like speed and endurance. So in this article, you can see the black line is a normal children, and the dotted line is a stunting children. And for this article, we can see the stunting children in 9 years old to 14 years old, they may have a low performance in standing long jumping for the girls. And from 8 years old to 15 years old, they may have a lower hand grasp muscle power than normal children. But something interesting is here. For stunting children, especially girls, when they are 10 years old to 12 years old, they may have a high performance in 12-minute round. That's very interesting because usually I would thought the stunting children, they may have a lower 12-minute round, they may have a lower endurance for running. But why this article just tells us they have a high performance in this? This is very interesting. I will tell you why. And the other one is a subtle run. It means the speed, running speed. So the girls, they have a higher stunting run. That means the speed is still lower, but they have a higher endurance in this article. And the other hand is a boy. The boy also like the same result. The boy has a lower strengthening in standing long jumping, and the boy also has a lower hand grasp ability. But the boy also have a higher 12-minute round. They have a high endurance in this test, but they also have a lower subtle run performance with normal children. So why the children with stunting or normal children, they were different result for physical? The reason is, first, the stunting children, they may reduce body size and muscle size. Doesn't mean they may have a lower muscle strength. So that's why the stunting children, they cannot do very well long jump. And the other hand, the normal children, they may have a greater fat mass, but the stunting children, they have a lower fat mass. So they will decrease their body weight. So that's why the stunting children, they can run in for a long time. They have a longer 12-minute running is better than normal children. But that's tell us the normal children, they may have a more fat mass, so they cannot run in so long. But the stunting children, they can. That's very interesting result for us. Okay, so before I just tell everyone what is stunting children, they have some physical problem or issues or growth hormone problem, and why they have this kind of problem and what kind of complication for them. And for now, I'm physical therapist. As a physical therapist, I will tell you why and how physical therapists can help stunting children growing up to help them have a better quality of life. So we will follow two rules. The first, we give the stunting children exercise. We have two reasons. The first reason, we give them more opportunity to increase their growth hormone secretion. And second reason, we will improve their exercise performance to improve their muscle strength. So that's why physical therapy do exercise for stunting children. And now let me introduce you guys how GH hormone, how GH secretion to help children growing up. So you can see this table. The first, the GH elicited by acute shortage of metabolic fuel and acute shortage of oxygen and increase in body temperature. This reason can help the children has more opportunity to increase their growth hormone. And the growth hormone improve the children's growing up. And why? What is the reason for children getting growth? The growth stimulated by, first, GH secretion to metabolic need, and second is mechanical stress, and third is intermediate stimulation. And what is a mechanical stress? In human, sometimes we say if we do exercise, we do strengthening, we do something, we have to use our muscle, and the muscle to stimulate the bone. That means mechanic stress. And the last one, intermediate stimulate. For us, we can use some kind of intermediate exercise. The exercise like a short time and resistant exercise for them, and have some break time, just like an intermediate exercise for them that could increase children growth. And exercise, how exercise improve the GH increase. The first, the exercise stimulation or a neuroendocrine program. So our pituitary will increase GH. The GH will divide to our body cells like a cell proliferation or cell differentiation. That's why the exercise could improve children's GH secretion. And the second, how exercise to improve stunting children's muscle power or their muscle behavior. The first, if we give children exercise, stunting children exercise, the muscle will be contraction. The contraction will generally improve a lot of mechanical stress on the muscle skeleton system. And then the exercise produce increased metabolic energy. And third, the exercise could help the muscle getting hypertrophic. So if the children have a more muscle strength, they can do very, very difficult things like a long jumping or in the functional way, like a basketball, walking on the street, walking on the stage, and they may have a more performance in exercise. So now I will show you some article for stunting children, and I have 3 articles for stunting children. I want to introduce you why exercise is that really the exercise really can help stunting children get more GH secretion. So the first is Dryer in 2021. The article they including 17 subjects and the age is between 5 to 14 years old, and all of children they have a good problem like stunting. So all of children, they into the group, the author gives them exercise we call high intensity interval exercise. What is high intensity interval exercise? That is the exercise gives children, the author used like a pedaling, like a bicycle pedaling for the children. And the program is the children have to ride the pedaling for 15 seconds and they have to against contrast resistance for 1 minute and for 15 seconds and take 1 minute break. In this session, all of children, they do this for 10 times. And the result, the author want to know the blood sampling and GH secretion. So result, the article tells us they have a significant GH peak correlation. They have a higher GH secretion. And the second article is Eliakim in 2005. In this article, the author including 50 children, the age from 8 to 17. But the children not stunting children, they are obesity children. Because in this article, I want to know even the normal children or obesity children, will they increase their GH after exercise? So the author divide the children out of children to group 2. The group 1 is 25 normal weight and group 2 is 26 obesity children. So the author gives them exercise like the first article, they do the pedaling, we call it exercise. So all of the children, they do the exercise, bicycle exercise for 2 minutes and take 2 minute break for 2 minute rest. So this program for them for do 10 times. The outcome, the author also see the GH secretion and the blood sampling. So for the result, the author found all of children, if they are normal children, after exercise, they have a more GH secretion, unless obesity children. So the obesity maybe is the one of the reason for stunting children, they will decrease GH secretion. And the last one article also Darren author in 2016, he including 10 subjects at the age from 9 to 14 years old. So all of the children into this program, they do the WANT, that's like a pedaling exercise for them. All of the children have to finish 30 seconds cycling with resistance. And the outcome is the author want to realize the GH secretion and lactate and other blood sampling. And the result is all of the children, if they after this exercise, they may have a high GH secretion. So in this article, we can see what kind of exercise were more efficient for children increase GH hormone, G hormone. That is a high intensity exercise. And how long we can do the exercise to stimulate children have a high GH? That's 30 seconds. Okay, you just need to exercise 30 seconds can improve your GH secretion, but not one time. You have to do this all the time, like 3 hours again, because our human already have already can increase the GH hormone, but exercise could help us have a more GH. So why exercise can help us to increase GH? Why we know the reason. So is that help us to improve our quality of life? So beginning the quality of life, I want to introduce what is the quality of life. The quality of life is in the family. Although family member, they can realize out of their family life, they have a well-being family life, and the family life and the well-being can correlative and subjective. That means the family member, they can say, they can realize, and they can tell us, I have a well-being family. That's FQOL, family quality of life. So what kind of tool can tell us what is the quantitative for the family's quality of life? We can use the Mandarin Chinese version of the Bench Center FQOL scale. That scale is 25 items. They have a 5 sub-scale like family interaction, parenting, emotional well-being, and physical material well-being, and disability related support. So in this article, if we give the standing children, they have a lot of physical support, they have exercise support. That's why maybe we can improve their family quality of life. And this scale, they have a 5-point Likert from 25 to 125. If the score is higher, that means the family has a high quality of life. So in this article, we can see the article is from Cho in 2020 years. And the article, we can see the author, they including a lot of kids with developmental delay. And some developmental delay, they has stunting problem. And if the children has a severe problem like cerebral palsy or severe disease, they were not including in this article. So the author including 14,299 patients in this article, the age from 0 to 6 years old. And they just want to know if this group of children, they have a disability, they have a developmental delay, and if the early intervention give to them, will they improve their quality of life in their family? So here, the early intervention is mean rehabilitation, exercise, and education. So as the table, we can see if the subject didn't have any intervention, didn't have any early intervention, the family quality of life like 89 score, the scores like 89. But if they have an early intervention after 3 months, the quality of life in their family, they will increase to 93.31. And even after 6 months, they also keep increase their quality of life. But in 12 months, after 12 months, the family quality of life start to decrease. The reason is the article say, some of the subject, they just feeling, oh, they no need anymore. They feel okay. So they leave this program. So that's why the result after 20 months, they will decrease the family quality of life. The reason is here. So as we can see in this table, we can understand after receiving early intervention, the family quality of life in families of children with development delay, maybe they can evolve significantly. That means they can improve their quality of life. So as today's sharing, I want to summarize what I tell you, my information for you. The first is the stunting children, they may have a high developmental delay. And second, the exercise could improve stunting children with motor developmental delay by change growth hormone secretion. And third, high intensity interval exercise is an efficient way of improved growth hormone. But maybe you will have some question. What kind of exercise is better for stunting children? Both of the exercise is very useful for them, like aerobic exercise or resistance exercise for them is very useful. But maybe we can use the high intensity interval exercise way, like you can give the children exercise or baseball game for 30 seconds and take a break and keep doing that for 30 seconds and take a break. that will be useful for them to improve their GH secretion. So that's why the WHO suggestion us all of children need to have a exercise per day, unless per day they must have a 1 hour less exercise. They have a 1 hour exercise per day. And last one, the exercise and early intervention could improve the family quality of life of children with development problem. Okay, so this is today my article, my information show you everyone. Thank you very much.
Okay, thank you, Mr. Yao. It was very interesting about your topic, the correlate about the growth hormone and stunting. Please give applause to Mr. Yao. Are you see us? Are you see us?
Yes, now yes.
Yeah. If you know, there are almost 300 in here. See you and listen to
No,
you. Yeah.
I don't know.
And also there are 200 in Zoom. So the total is all about 500 participants. Yeah.
Okay. Yeah.
Okay, Mr. Yao, please still stay in Zoom. Okay, after we have the discussions. After the expert panel explain the materials. So we're going to the second speakers. Madam Emily. Madam Emily. Are you still in Zoom? Madam Emmeline Suarez. Madam Emmeline Suarez.
Yes, ma'am.
Okay. Magandang umaga.
Waiting for my turn.
Okay, we are going to your session. So I would like to explain your curriculum vitae. Madam Emmeline was graduate from the Emilio Guinaldo College, and she was working as a clinical instructor in School of Midwifery and Caregiving in Emilio Aguinaldo College, and also Madam Emmeline as a caregiving, and also has a experience in blended skill enhancement training for midwife. So you have 40 minutes to explain your material. Are you ready?
Yes, ma'am, I'm ready.
Okay, time is yours.
Okay. It's already afternoon here in the Philippines. So good afternoon to our organizer, to our all 600 participants. It is my honor as one of your guest speaker for this very momentum event. By the way, I am Emmeline Suarez Minorca, a faculty from Emilio Aguinaldo College School of Midwifery, Manila. Now, since the midwife is responsible to take of the pregnant woman and unborn baby during or throughout her pregnancy, explaining why eating of healthy food and doing good hygiene are matters. According to WHO, stunting is one of the most significant impediments of human development. Stunting also has a long-term effect, which include diminished cognitive and irreversible outcome of inadequate nutrition and repeated bout of infection. However, in the Philippines, this is supported by the RA 1148 or the Kalusugan at Nutrition ng Magnanay Act. Through this law, mothers and their children will have access to a strengthened
integrated strategy that covers maternal health, child nutrition during the first 1,000 days of life. Now, what is 1,000 days of life? The first 1,000 days of life, also known as the golden window of opportunity, is the period within good nutrition must be given to mother and child to ensure the child proper growth and development. This period starts from pregnancy until child second birth. During pregnancy or 270 days, the midwife is responsible to take of the pregnant woman and her unborn baby throughout her pregnancy. And for the normal or uncomplicated pregnancy, they are going to have at least 4 prenatal visits. And the first visit within 3 months, or during the first visit within 3 months, the midwife will assess to the pregnant woman, such as taking a complete information data, comprehensive history of age, gravidity and parity, LMP or last menstrual period, AOG or age of gestation, as well as the history of previous pregnancy and pregnancy outcome, including the preterm birth. Now, vitamins and mineral supplements such as iron supplementation for the maternal to prevent anemia and folic acid for the developmental of the baby's nervous system and prevent fetal neural tube defect. Give health education and promotion such as nutrition, weight gain, hydration, sleep, exercise. Nutrition, why? Because eating nutrient-rich food is vital in promoting the mother's health and the baby's growth and development. Weight gain. Also, it is normal to put on pregnancy-related weight as the baby grows. Limiting the amount of weight gain can contribute to better overall health. Now, hydration also. Hydration is the key to healthy pregnancy. As water helps, the body performs various functions that nourish and support the developing baby. Sleep. Why sleep? Because pregnant women may feel more tired than usual, and sleep helps them to get rest they need. Exercise as well. Exercise helps pregnant women prepare their bodies for pregnancy and recovery after birth. Now, in the second visit, or at the 6 months, the midwife gives or continue of the micronutrient supplementation. Iron for the maternal to prevent anemia, multivitamins and calcium for the healthy bones and both maternal and fetal. Council of family planning, because too close of birth intervals has led to anemia and malnutrition to mother. It is also increased vulnerability and illnesses. Early advice for exclusive breastfeeding, also after birth or during postpartum to help the uterus contracted. Now, become counsel on nutrition also for pregnant women, smoking cessation, healthy lifestyle, parent-child interaction, responsive care, and early psychosocial stimulation for early childhood development, because improper diet, or malnutrition of mother during pregnancy is a risk factor in having low birth weight and cause of stunting. Being overweight also is a risk factor because it can lead to diabetes, which may complicate for fetal development at birth. Now, maternal immunizations should be given also, including tetanus toxoid and diphtheria toxoid to prevent tetanus neonatal. And the third visit at 8 months, okay. And the third visit at 8 months and fourth visit and 9 months, on all succeeding visits, continue doing the following as on the second visit, as well as the duration of pregnancy, or AOG, or age of gestation, and fetal heart tone, or fetal heart tone monitoring din, then in preparation for delivery. Now, pregnant woman who do not come for prenatal care should visit it at home. Why? To monitor the status of maternal and as well as the fetal well-being. Now, during infancy, or 180 days, for the first 6 months, exclusive breastfeeding again is the most ideal way of providing food for the healthy growth and development of infants. It is also an integral part of the reproductive process with important implications for the health of mothers. Breastfeeding also is breast milk also is an important source of energy and nutrients in children 6 to 24 months of age. It can provide 1/2 or more, or 1/2 of a child's energy needs between 6 and 12 months of age, and 1/3 of energy needs between 12 to 24 months. Okay. Now, during infancy, okay, also infancy during 100 days of life, practices of essential and newborn care, initiate breastfeeding within the 90 minutes or 1.5 hours after birth. Infant should be initiated to breastfeeding within 1.5 hours because after birth, because the first milk or colostrum is the perfect first food for babies because it contains with more nutrients such as proteins, fat, carbohydrates, water, flavor as well, and vitamin E, as well as the first immunization of the babies against many bacteria and viruses. This will stimulate also as early onset of milk production and promote bonding of mother and child. Now, infants should be exclusively breastfed for the first 6 months of life to achieve optimum growth and development. Iron deficiency anemia is rare in the first 6 months to 8 months or with exclusive breastfeeding again, who will be born healthy and full term and without premature cord clumping. Now, immunization also is important to help them and prevent the spread of disease and protect infant and toddler against dangerous complications. Now, in summary, Regular antenatal visits help to establish a good relationship between the healthcare professional and the mother. Track the progress of pregnancy and administer the necessary interventions and provide support through counseling. And pregnancy is a state of high nutritional and vascular demand. A healthy diet consists of various micronutrients and macronutrients. In summary, also, weight gain is the natural part of pregnancy. However, the amount and rate of weight gain is an important indicator of material and fetal health. Inadequate or excess weight gain during pregnancy may be suggestive of problem in the pregnancy. Now, again, in summary, again, conduct growth and development monitoring and promotion for children 0 to 2 years old. We have to identify and manage cases of moderate and severe acute malnutrition. Provide oral health services to pregnant mothers and children. Now, counseling and lactation management support should be given to lactating mother to encourage exclusively breastfeeding in the first 6 months and continue breastfeeding up to the 2 years and beyond, especially for mothers who will return to work. Nutritionally at-risk lactating women must also be given dietary supplementation. Organize community-based mother support groups, and peer counselor. Provide lactation support in the workplace, such as lactation station and implementation of lactation breaks. Families should have access to safe drinking water and sanitation toilet facilities. Provide counseling in hand washing, environmental sanitation, and personal hygiene. Counsel and encourage utilization of reproductive health and family planning services. Provide social welfare support and family, especially the nutritional vulnerable households, to improve access to health and nutrition. Now, let me read this short message. Good nutrition, health, and proper care in the first 1,000 days gives the child the best start to life. Now again, I am Emily Suarez Minorca, Faculty of Emilio Aguinaldo College, School of Midwifery, Manila. Next. Okay, thank you so much. Thank you for listening.
Okay, my pleasure, Madam. Give applause to Madam Emeline. Yeah. Okay, Madam Emeline, please stay in Zoom. We are going to the next speakers. Okay, we're going to explain the curriculum vitae first. For the next speakers is Miss Tia Nur Hanifa. She is lecturer in midwifery in STIKES Telogorejo Semarang. She was graduated in Universitas Aisyah Yogyakarta. And for the certifications are pelatihan pekerti, pelatihan item development, item review, and item bank administrator. For the skill that she has a meta-analysis research strategy, multivariate research strategy, and also child care loving pediatric message therapy. So please welcome Miss Tia. Yeah, give applause to Miss Tia. Okay, Miss Tia, how are you? Okay, I move to there.
Okay, thank
Okay,
you.
how are you?
I'm fine. Oh, standard.
Okay, it's good.
Oh, yeah.
Okay, are you ready to explain to the audience about the role of midwife?
Oh, I'm ready.
Okay,
Okay, thank you.
you have 20 minutes. Time is yours.
Oh, yeah. Okay, thank you, Miss Mother. Okay, Assalamualaikum warahmatullahi wabarakatuh. It's good morning or good afternoon. But I hope you guys in morning 5. So have a spirit morning. Good morning, everyone. Okay, thank you. Okay, today I will represent about role of midwife in antenatal care, internatal care, and postnatal care. Okay. Okay. PPT, please. Okay, wait. Okay, thank you. Okay. Okay, everyone, I will tell you about role of midwife in antenatal, intranatal care, and postnatal care. Okay. Next, please. Okay. Okay. Midwife Association Indonesia atau Ikatan Bidan Indonesia. Midwife is a woman. In another country, midwife a man is no problem, but in Indonesia, midwife is always woman. Midwife is a woman who has graduated from midwifery education, recognized by the government and professional organization in the territory of the Republic of Indonesia, and has the competence and qualification to be registered, certificate, and legacy license to practice as a midwife. Okay. In Indonesian regulation number 4 of 2019, midwife are averagingly rated with a midwife in providing midwifery service to women before pregnancy, in pregnancy, intranatal, postnatal period, newborn, infant, toddler, and children preschool, including reproductive health, women, and family planning, is accordance with duties and authority. Next, please. Okay, stunting. Stunting is impaired growth and development that children experience from poor nutrition, repeat infection, and inadequate physical stimulation. Cause of stunting is not exclusively feeding. So if we have baby, we must give breastfeeding, exclusive breastfeeding. Inadequate feed intakes, negative parenting style, child with repeat infection, hygiene and sanitation, and poverty or economy. Okay. Prevalence of stunting. Prevalence of stunting by WHO said prevalence stunting in 20 and 22 is 148.1 million children under 5 years of age, where too short for the age have a stunting. And in Indonesia, based on data ASEAN Development Bank, in 20 and 22, prevalence of stunting among children under 5 years in Indonesia is 31.8%. Indonesia is in 10th place in the South Asia region. In 20 and 22, based on data from Ministry of Health, Indonesia stunting rate has decreased to 21.6%. Okay. It's prevalent stunting in Semarang. In Semarang is one of city on Indonesia. Semarang Tengah, Semarang Utara, dan another. Okay, so government have a program for prevention by stunting is 1000 hari pertama kehidupan, or first 1000 day of life. In Indonesia, it means 1000 hari pertama kehidupan. What is 1000 hari kehidupan atau first 1000 day of life, which is in 270 day during pregnancy and 730 day in baby first life. Okay. So, what's mean about first 1000 day of life? First 1000 day of life is the golden period start from pregnancy until the baby or the child is 2 years. Why with first 1000 day of life? So first 1000 day of life, in this period is a golden and critical period with the growth of brain tissue across rapidly. So that it has a big influence on the next period of life. 80% of human brain develop across during the 1000 hari pertama kehidupan atau first 1000 day of life period. The rest occur in the next period of life. Malnutrition during 1000 hari pertama kehidupan or first 1000 day of life period is causing the disease like hypertension, diabetes, and etc. Okay. So what midwife do for this condition? Okay. Role of midwife in antenatal care is 1. Assistant for chronic energy deficiency pregnancy women. 2. Consuming supplement feeding recovery atau PMT. PMT it mean in Indonesia adalah pemberian makanan tambahan. Women with energy deficiency it must get and consumption PMT atau supplement feeding recovery. Distribution and supervision of pregnant women taking FS supplementation minimum 90 tablet during a pregnancy. antenatal care for pregnant women, education on balanced nutrition, early initiation of breastfeeding or IMD atau inisiasi menyusui dini, and exclusive breastfeeding. Okay, next. Role of midwife in antenatal care. Confirming pregnant women consumption nutrition, food balance according the nutrition adequacy rate of pregnant women. Confirming pregnant women with chronic energies to consumption PMT, and confirming pregnant women to consumption FA supplementation. Okay, how about in antenatal care? And antenatal care examination is pregnancy examination which aim to improve the physical and mental health of pregnancy women optimally, so they are able to labor, postpartum, and prepare for their breastfeeding or exclusive breastfeeding, and return the normal reproduction health. And pregnancy examination occur at 4 times. In antenatal care, midwife have a 4-time visit. Okay, 4-time visit. When first time, one examination in first trimester. And then one and second trimester. And 2 in third trimester. Okay, so midwife have antenatal care for a pregnant woman in minimal 4 times. 1 time in first semester, and second 1 time in second trimester, and 2 times in third trimester. So, in antenatal care, with midwife do anamnesis, weight observation, blood pressure, check. The health of the uterine is checked, or it means check the TFU atau tinggi fundus uteri, or height of fundus uterine, tetanus vaccination, FA supplementation, determine nutrition status, laboratory test, determine the fetal heart rate. Fetal heart rate, it means in Indonesia DDJ, denyut jantung janin, fetal heart rate. Early detection of pathology pregnancy. In antenatal care, we must doing early detection of pathology pregnancy as a pregnant woman not have anemia or deficiency FA. Okay, and then case management. Okay, next antenatal care, and then we have role at midwife in intranatal care and postnatal care. Intranatal care, 1, make sure women of reproductive period to use contraception or have family planning. It is hoped that will be planned during a pregnancy. And then 2, make sure postpartum women get PNC atau or postnatal care. Postnatal care visit on a schedule. Midwife can visit postnatal care in 4 times. 1 time in 6 hours after postpartum. Second time in 1 week after postpartum. And then third time in 2 weeks after postpartum, and the last fourth time in 6 weeks after postpartum. And then make sure the woman there are not have complication on postpartum. Okay, and then as a midwife, we must make sure a woman give the baby exclusive breastfeeding in babies up to 6 months. And then make sure postpartum women have adequate nutrition intake in breastfeeding. Okay, some like we know in Indonesia have a mythos. I have a mythos. Postpartum woman can take protein. So we as a midwife give a postpartum woman education about is a protein in postpartum is so it's so difficult. It's so useful. It's so useful for a postpartum woman. Okay. Thank you.
Thank you, Miss Tia. Yeah. Okay. Please sit down, please. Yeah. We're going to the last speaker. Okay, for the last speaker, I would like to explain the CV. It's our lecturer. Her name is Miss Rajil Aidil Fitriasari Adini. She is lecturer in STIKES Telogorejo Semarang from the psychotherapy department. And she was graduated from Universitas 11 Maret. And for the research, the latest research is pengaruh terapi klasik Mozart dan aroma lavender terhadap kualitas tidur pada lansia di Panti Breda Rindang Asih 1 Semarang. And also there are a lot of publication and also workshop. So please welcome Miss Ragil. Give applause to Miss Ragil. Okay, Miss Ragil. Are you ready? You have 20 minutes to explain your material.
Ready, Miss?
Okay, time is yours.
Have I can permission to sit?
It's okay. Yeah, it's okay.
Okay, thank you, everyone. Maybe a student of physiotherapy department know me. Yeah, I'm sorry if my English not well because I'm so nervous today. Okay, it's such honor to me to stand here, like as a speaker. Yeah, are you still enthusiastic? Yes or no?
We can hear you. Are you enthusiastic? Yeah, that's good. It's morning vibes. Okay.
Okay, today I would like present about my material, the role of physiotherapy in the growth and development of children due to stunting. Here I will explain about role of physiotherapy because the previous speaker has a lot explained about stunting. Okay. Stunting is a chronic malnutrition problem caused insufficient nutritional intake over a long period of time. This is appearance about child stunting. The child is shorter than normal children of his age and experience delays in thinking. So, child with stunting does not shorter than normal age, but experiences delays in thinking too. If child get a problem of health, it will have an impact of health too. These are figure about stunt child, right? And this one is called normal child. If baby or child impact of the malnutrition in early life, she have an impact for one failure to grow. It will have to low birth weight, short, small, and thin. Second, if the baby or child have malnutrition, it will have to barriers to cognitive and motor development. And this one will have an impact of brain development and educational success. And third, metabolic disorder in adult. So if a baby have a metabolic disorder in adult, it will have to increase the risk of non-communicable disease like diabetes mellitus, stroke, and heart attack. So we can, as physiotherapy, we can help the child with stunting to preventing stunting can start from the first 1,000 days of birth, because 1,000 days of birth start pregnancy until 2 years child. The first pregnancy, mother pregnant need to nutrition, need to a lot nutrition for height and weight baby, and after the baby is born, baby is need to nutrition a lot like protein, calorie, and for grow baby. Also, pregnancy exercise can reduce problems during pregnancy, and breathing exercise and pelvic floor muscle training. We can give an exercise of pregnancy mother because pregnancy mother have a lot benefit. And then we can give a postpartum exercise after the mother birth. We can give the postpartum exercise because postpartum exercise can make mother recovers quickly and breast milk production runs smoothly. And the next, we can give her baby with oral exercise. The oral exercise can improve breastfeeding ability on baby, and baby massage can increase metabolism and then stimulate increased growth and development of the baby. Remind for me, physiotherapy intervention can be given according to age stage, including providing stimulation and motor movement exercise. Factors that cause stunting are also factors that cause developmental delay. This is first, low birth weight, inadequate nutritional intake, and infection disease. Kids who experience stunting tend to experience developmental delays. Developmental delays disorder characterized by slow maturity of nerve cell, slow motor movement, a lack of intelligence, and slow responses. Maybe before we discuss about delay development or developmental delay, we must know what is the child develop. So, child develop refers to how a child becomes able to do more complex things as they get older. And grow only refers to child getting bigger in size. Okay, this is normal child development. Normal child development is a child's ability developed in a particular order, once upon the other, like building blocks. Children develop skills step by step, like building blocks. Every children develops in three main areas: physical in the body, mental in their mind, and social in their communication and relating to other people. So before baby walking, baby must have to trunk control is good. Before standing and walking, baby must have to trunk control for sitting and balance, and before sitting and balance, baby must do head control is good too. So it is important for parents to realize that a child develop control and use of her body is certain order: head control, trunk control, and standing and walking. Like develop progress from head to foot. For example, first head and eye control, next arm and subhand control, trunk and body control. After then sitting and balancing, and finally leg control. So the baby can standing and walking. Now we can we discuss about developmental delay. Developmental delay is when a child does not reach their developmental milestone at the expected time. Developmental delay is not uncommon and occur in 2 until 3% of all children. The developmental delay can occur in one or many areas, for example, growth and fine motor, language, social, and thinking skill. There are many different causes of developmental delay. It can occur during pregnancy, around the time birth, and after the baby is born. For the first, genetic or inherited condition, being born too early or premature, and birth injury or other injury, hearing or vision problem, family stress, which can mean a baby does not get conscious loving care in early weeks or months, and being exposed to some drugs before birth or alcohol. The children with delayed development will have problems. They may have a problem with movement, communication, speech, language, learning, behavior, play, social skill, and interacting with others. Parent and therapists, or we can help children development delay with early stimulation. Early stimulation is necessary for the whole growth of every child body and mind. Early stimulation can do repeat in home with easily. For the first, what parents can do help children develop with early stimulation? With movement, body control, strength, and balance. This will help a child both about do things, play, and work. 2. Use the hand, increase hand control and coordination of hands with what the child sees, allows the child to develop many skills. And 3. The sense, especially seeing, hearing, and feeling. This will help the child recognize and respond to her world. Number 4, communication, listening, understanding what to say, and learning to speak or to communicate in whatever way is possible. Number 5 was interaction with other people. Smiling, playing, behaving appropriately, and learning to get along with others. And number 6, basic activity for daily living like eating, drinking, dressing, and control of bowel and bladder, and the self-care skill help the child becomes independent. Remind, suggest for doing learning activity with child, be patient and observant, be orderly and consistent, use variety, be expressive, be confident, and be practical. Okay, I think it's enough, Mrs. Mother.
Thank you. Yeah, give applause to Ms. Ragil. It's my pleasure to have you, all the speakers. Okay, we're going to the discussions. I move here and here again. Okay, we are going to the discussions. Mr. Yao and Madam.
Yes, I can hear.
Here. Okay, we are collecting the questions. Mungkin yang di sini boleh bertanya pakai bahasa Indonesia, boleh. Nanti kita bantu translate. Ada yang mau bertanya? Ada yang mau bertanya di sini, teman-teman semua? Silahkan, boleh loh ya. Okay, for the first questions is for Madam Emmeline. Yeah. She's from Poltekkes Kemenkes Jayapura. And for the questions is, what the role midwife to prevent stunting in your country, ma'am? Madam, can you see it? Madam Emily?
Yes, ma'am.
Okay. So the question is, what the roles midwife to prevent stunting in your country? It's
Okay.
Yeah.
Okay. The question is, what the role midwife to prevent stunting in your in our country here in the Philippines? You mean? Now, the role of stunting, to prevent stunting here in the Philippines, first thing to do is exclusive breastfeeding. Exclusive breastfeeding. Can you hear me, ma'am? Hello?
Yes,
Okay.
it's
Okay.
about to educate the breastfeeding.
Yes,
Okay.
exclusive breastfeeding, or after, here in the Philippines, after 1 hour, 1 hour and a half, the baby must be initiated to breastfeed, to breastfeed the mother, and as well as the non-separation. Why 90 minutes or 1.5 hours? Because of non-separation of the baby from the mother, and premature cord clamping is can help to prevent stunting, as well as the complementary feeding. Okay.
Yes. Okay, so it's for all the mothers.
Yeah. So give them a right nutrition, as well as the exercise, hydration, weight, or she may be sleep well. Because pregnant woman maybe feel more tired than usual. And vitamins, the micronutrients and macronutrients during pregnancy. That's very important also. So educate the mother for hygiene. Yeah. So that's all the how to prevent stunting here in the Philippines.
So it's really important, the role of midwife to prevent the stunting. Yes, ma'am. Okay. Okay, ma'am, maybe you want to explain again?
Yes, ma'am. Hello.
Oke, untuk Mbak Rohmani, mungkin ada yang mau ditanyakan lagi, apakah sudah jelas? Is it clear for Miss Rohmani? The answer from Madam? Okay, there is another questions from Miss Madam Crescencia Santos from CAU. Good morning, Madam. Okay, the question is, do you have a standard tools or instrument used to assess the delay of children in Indonesia? Example of standardized tool is the Denver Development Screening Test, or the Philippine versions is the Metro Manila Developmental Screening Test. Okay, Miss Tia, maybe you want to answer it?
Okay, thank you for the answer. In Indonesia, tool of instrument delay of the children, we have Denver. Some like in another country maybe yes. We have to instrument to test the children. We have Denver. Thank you.
Okay, so in Indonesia, we also have a Denver, but it's Indonesian version, Madam. And also in child nursing, we use KPSP. We call it KPSP to assessment the development screening. Oh, and also Denver. In physiotherapists, they assess the development.
Yes, in physiotherapy, have a standard tools instrument tool used to assess the delay development with Denver development screening test.
Okay, for the physiotherapy, they also use Denver to assess the children. Okay, yeah.
And
Okay, can I share?
Questions, Madam?
Okay, I'm Yao Qin. I also want to share in Taiwan if we want to extend. examine children with stunting, we can use PDMS2, or if the children is very young, we also can use TIMP and AMS also.
Oh, in Taiwan also has their own assessment tool, Mr. Yao.
Yeah, in Taiwan we have only for Taiwan's children, but that's screen. That is not exam, it's a screen.
Oh, it is for screening. It can
Yes.
use by the professional help or for the publics.
For publics, even the parent, they can download that from the internet, but it's Chinese version.
Oh, okay. Oh, and also I would like to ask to you, Mr. Liao, it's very interesting, your topic about the correlate the growth hormone to the stunting. How significant the effect of stunting in the growth hormone?
Sorry, did you mean how significant of the growth hormone for stunting children?
Yes, the impact, how significant the impact according to the research that you know?
Okay, you mean how significant for if we use exercise for the stunting children, how was the specific or how was the infection, right?
Yes.
Okay. From article, some author they just think if we keep give the children they have a stunting problem, if they do the exercise like high intensity, but the intensity have to according to the children. For example, if some children they feel okay walking for 10 floor, that is a higher intensity for them, but that is a ceiling exercise for them. So any kind of exercise for them is okay. Only the children they feel that's very strong for them, and you have to keep the exercise for 30 seconds. Only 30 seconds we can improve the GH increased, but you have to keep that like for 5 times to 10 times that can increase the GH increase.
Okay, that's why it's very important to assess the development children when they had stunting cases, right?
Yes. And some study tell us if we give the children the exercise, intensity exercise, after 3 minutes to 15 minutes, we can have a result of their GH screen already increased.
Okay, thank you, Mr. Yao. It's really enlarged our knowledge about stunting and psychotherapy way. For the speaker, I'm really sorry to say that we have a limited time to have a discussions. So we close the questions. So maybe if you have a questions, you can still chat to the Zoom, and we will help you to contact the speaker to answer your questions. Is it okay, Mr. Yao and Madam?
No problem, thank you.
Okay, we would like to conclude the second sessions. The conclusions is stunting is currently a major problem in health because the prevalence of stunting continues to increase. The high risk of motor development delay in children with stunting. Exercise could improve stunted children with motor development delay by changing growth hormone secretions. High intensity interval exercise is an efficient way of improving growth hormone, but both acute aerobic and resistant exercise produces a similar growth hormone response. Exercise and early intervention could improve the family quality of life of children with development problems. Counseling and lactation management support should be given to lactating mothers to encourage inclusive breastfeeding in the first 6 months and continue breastfeeding up to 2 years and beyond, especially for mothers who will return to work. Provide lactation support in the workplace, such as lactation stations and implementation of lactation breaks. Provide counseling and hand-washing, environmental sanitation, and personal hygiene. Provide social welfare support to families, especially the nutritionally vulnerable households, to improve access to health and nutrition services. It's like Madam Ellen say that good nutrition, health, and proper care in the first 1,000 days give the child the best start to life. Okay, it's the end of the second session. Thank you all. Please give applause to all the speakers. I give it back to the Master of Ceremony. Thank you.
Let's give warm round of applause to our speakers and our moderator in session 2. Thank you very much. Okay, next session, we appreciate to our very great speakers, and we will give in certificate as a speakers in session 2. May co-host show the certificate. Yeah. Okay, especially to Prof. Chin Yong Chang and Ma'am Emeline Suarez Minorca. Thank you very much to your presentation and then speaker. Giving certificate and gift from Miss Tuni to our very great speakers, to Miss Tia Nurhanifa and Miss Ragil Aldil in session 2. Miss Tuni and our speaker, please come to podium.
Enggak guys. Okay.
Thank you, everyone. Please take your seat. Oh, okay. Take a photo before. Thank you, Ma'am Tuni, Miss Tia, and Miss Ragil. Ladies and gentlemen, we have now complete seminar session, and we hope you have found them informative and engaging. We will now take a 30-minute break in 1:15 until 1:45 p.m. So ladies and gentlemen, please enjoy your break and see you back here in 1:45 p.m. in Indonesia. In on-site partisipan, setelah ini kita ada oral dan poster presentasi. Jadi teman-teman para partisipan jangan beranjak pergi. Silakan untuk mengikuti oral dan poster session yang telah disediakan di ruang 501 503, dan 504 untuk oral presentasi, dan 508 serta 509 untuk poster presentasi. Jadi silakan kita ada break sekitar 30 menit, jam 1.45 mungkin teman-teman berpartisipasi bisa menghadiri dan menonton para partisipan yang akan oral presentasi dan poster presentasi. And then to online participant, after this we continuing in oral and poster presentation session. So the participant still stay in Zoom meeting and move in breakout Zoom at 1:45 p.m. Indonesian, and 5 p.m. we gonna do closing and announcement the winner oral and poster presentation. Thank you. Untuk yang ada di onsite di ruang audit, setelah kita selesai oral presentasi dan poster, kita akan mengumumkan pemenang the best poster dan the best oral presentasi at 5 p.m. Thank you very much.